Good morning, everybody, and thank you very much, and apologies for that slight delay. So members of the public are also welcome, and those online. As you know, I'm Jill Slocum, I'm the chair of the committee. The agenda pack with papers is available via ModGov or directly from the council's website from the link which was sent out to members. In line with the recommended meeting procedures, I'm requesting all members please turn off your microphones and videos. And please remember to turn off your mobile phones. As obviously any background noise is affected. I invite you to speak. Could you clearly state who you are for the benefit of anyone who's listening to the meeting so they can identify you. Please can I remind all committee members to use the chat function solely for committee business, and it is distracting or other questions, conversations happening. Can I please warmly welcome you all, members of the public, media, who may finally join us. Finally, agendas are now viewed electronically. Could I request that members and officers refer to page numbers from the published agenda pack to assist to present the finding of the appropriate information? I think you're all aware of that. Thank you. Right, item 1 is apologies for absence.
We've had apologies from Councillor Tony Robbins.
No one else?
I'll give apologies for John Bailey.
Okay, we are a couple short today, so and Councillor Osborne is going to arrive late. Thank you. Item 2 is minutes of the previous meeting, pages 7 to 16. Have your agreement that you approve the Councillor Bruce?
Thank you, Chair. I believe I was present at the meeting, but not on the list.
You were present. We'll get that sorted. Thank you. So with that amendment, are you all happy with the minutes of the meeting? Everybody happy? Nobody's not unhappy. Thank you. Item 3 is declarations of interest. I invite you to declare any interest and make you aware of the list of committee members' personal interests as members of the district, town, parishes, councils available for inspection on the website. So is there any further declarations of interest? No? Item 4 is public question time. Do we have any public question time? You're not? Okay, thank you very much. I'm now going to give you an update, which is unusual at this stage in the agenda, but I'm just going to give you this update. At the meeting of the 8th of February, the committee resolved to write to the Secretary of State for Health and Social Care. The letter was sent on the 15th of February, and to date, there has been no reply. On the 20th of March, committee members were invited to a briefing with the Chief Executive, Duncan Sharkey, to clarify his role on the ICB. Mr. Sharkey explained that he did not represent Somerset Council on the ICB. He was there as a partner organisation, and in this role, he was expected to look at the evidence presented and make an informal decision on the recommendation. He did ensure that those concerns raised by councillors and other interested parties were included in the debate, and then cast his vote freely in the best interest of the Somerset residents. That, as you know, this was recorded. Certain members were allowed to look at this, and I think we are where we are. I don't think we need to debate this any further, but yes, obviously we'll give you an update when we get from the Secretary of State. Okay, thank you. Item 5 is the work programme. Now, as you see, the one that was printed out on the work programme is slightly different. So apologies for that. There are 3 dates, an update to the provisional dates on the Thursday, the 11th of July, possibly Thursday, the 22nd of August, or Thursday, the 10th of October, Thursday, the 10th of October. Do we have any comments about those dates provided? Hilary, you're looking worried.
I'm just confused because I'm looking at the ModGov notes. There's none of those dates in here. So where are those dates? Will it?
They were only agreed this week, and the invitation's just been sent out, so those dates should have been sent out to all councillors, I think yesterday, but the meeting agenda was only just agreed 2 days ago. Apologies for that.
Can I also say, with the calendar, there's been lots of changes on the calendar. We were pushed back to Tuesday, but we fought hard, didn't we? We fought hard back to our Thursday, because I know that's where regularly, and also it did clash with planning for many people. who were nearly killing themselves to get back if they weren't in this room. So therefore, or if you were planning somewhere else. So I have fought really, really hard for this committee to keep the continuity of the dates that you have, okay? So apologies about the late arrival of this, but it is almost at the last hour. These dates have been confirmed. Now, with these 3 dates, we're just, what I would like to suggest with your agreement is that we have not a workshop, not a briefing. I don't know what we call it, but I think we need to meet in May at some point and perhaps discuss where we are and discuss where there's certain elements of the committee where you feel that you'd like to go forward. How are we progressing? So it's a bit of everything all chucked in. And I just wondered if members would be happy. I'll call it whatever you would like to call it, get together, whatever. But I think the committee needs, I think we need to recoup back together and yes, we reaffirm where we're going, what our expectations are and what we want to do. So is everyone happy with that? So I will leave that to Jenny to send those dates out for a May briefing or a May workshop, whatever anyone wants to call it. Maybe workshop on this point is a good idea. And I think that will reaffirm us an agreement. Sorry, Sarah, sorry.
Yeah, just to say to that you might find that useful when you've got the full peer forum report.
Yeah.
Because it hasn't come in yet, but when it does come in, it will have quite a lot of detail in it that we haven't got yet. And that might be something that you could usefully discuss, because it is a really thorough look at what we're doing. So I would recommend you have that, perhaps as something to work on.
Yes, we have got the performance review, and there is some other bits I can give up, but that's a very good point. And I think that will be where we know where we are. So, like I said, I think it's just a reaffirming for us to be together. Okay, so thank you very much. Sorry, Hilary. Sorry, Councillor Bruce. I do apologise.
It's all right, don't worry. Just a request if it could be on online meeting rather than in person, that would make it easier.
Oh, certainly.
Thank you.
Yeah, certainly. That's okay. That's a good point. So we're doing online. All right. Thank you very much. Thank you. Other dates. Now, these dates may slightly change because they've only just 2 days, but they will be around this time. So I'm going to leave it with Jenny just to firm up, because as you can appreciate, getting the room, but we're trying to make this as clear as possible so that you've got a forecast in your diaries. Okay. Thank you. You happy, Jean?
I was just going to say, and on that, if there is concerns about the 22nd of August, which I know is right bang up against the bank holiday week, can you let me know? Because I'll see if I can move that 1 week earlier. So if anyone's got leave or concerns that they have at that August date, just drop me a line. Thank you.
Thank you. So we're very accommodating here. It's about getting people here. That's most important for us. Okay, so right, the next item is item 6, which is the budget monitoring report. Oh, sorry, apologize.
Sorry, Jay, it was actually in terms of the work programme itself, what's in there. I'm still concerned that we've, on the list of new items as of February, workforce is listed as a new item. It's not new, it's something we've been asking for ages. And we've got a whole list of dates here which go to the end of the year and it's still not in there. You know, how much are we going to push it back? We're not going to look at the workforce until next year now. I'm just a bit concerned that that's not in there yet.
Okay, now do you want to?
I'm happy to do it whenever you say you want it. We can stand you up, no problem at all. We have a workforce board, we have a workforce strategy. All of that can come to you whenever you need it to do so. You tell me when you want it, we'll make sure we come and join you in that session.
All right, that's a good point. Thank you very much, Councillor Bruce. Thank you. We'll have that in the next meeting then. Okay, that's the August meeting. It's possibly going to be the week before. Okay, we think that a couple of people have already come and said that date is not good, so it'll probably be the 15th. All right, but we'll get that information out to you very, very quickly. Okay. We now have item 6, which is the 23-24 budget monitoring report, which is the month 10. And I'm going to before I hand over to Penny Gower, I think Councillor Wakefield would like to have a few moments, please.
Yes, thank you very much. As the newly appointed ad hoc social care lead, I do want to take the lead in some of these things, just introducing them. I'm very pleased to introduce this month 10 budgetary report, which I think obviously everybody realises now we've gone past the end of the year. We have got to the month 12, but we don't tend to do a month 11 report. So this is kind of the nearest you're going to get to the year end at this point of the time. I just wanted to point out a couple of things. In 5.14 on page 24, this is on the ModGov pages. I don't know if they're the same as the ones online. I really don't know, but they should be similar, but they're not the same. At 5.14, there's a reference to commissioning is currently projected to overspend by 1.1 million as the adults transformation My Life, My Future will not achieve the full £5 billion saving in this financial year as was the last financial year. That's going to be dealt with later. That point is going to be dealt with later, but people should just be aware of it. We didn't actually start the work on My Life, My Future until July, so you wouldn't really have expected to get a full 5 million in the first year. And I think that, as I say, that will be explained later on in the meeting. And at 5.19, where it talks about mitigations, and 5.18, that's on page 26. I just wanted to point out that, as it says in 5.18, 90% of the adult social care budget is spent on individual placements, and that's care packages, people in care homes, and direct payments. So when we look at how this money is spent in this department, you just have to be aware that most of it, 90% of it, is really spent on demand-led care. So when we look at savings, it's, you cannot save unless you reorganise what you're doing, and that is part of what is happening. But demand-led placements have to be paid for. And I just wanted to make those points before you go into the detail of the report. Thank you.
Thank you very much, and forgive me, Councillor Wakefield, for not welcoming you as the new portfolio holder or cabinet member or executive member. Executive member, sorry, forgive me. There's so many changes on what you're called, but we do welcome you. And obviously, as the leading group, you will have inside information, so you can spill the beans, and as it were. And but we welcome you, and we hope that we can. We need to move together to make sure that we get a conclusion and we get some good recommendations to go forward. So now I'd like to invite Penny Gower to. Oh, I beg your pardon. It says Penny. You'll do.
Thank you, Chair. So I'll just introduce myself then. It's Chris Evans, Head of Finance Business Partnering, and my colleague Penny is here. We'll go into detail on some of the report later on. Okay, so this is the budget monitoring report to month 10, as Councillor Wakefield has said. So this is the end of January. So from an overall corporate position, it's £16.3 million overspend is predicted at the moment. Both adults and children's predicted 14.9 million, with an offset from some of the underspends in climate and place brings it down to that level. It is £200,000 better off than it was in month 9. So moving on to a bit more detail into adult services. So net budget, 181 million for 23-24. Overspend would have been 24.2 million predicted, but with some mitigations.
Apologies, can you make that any bigger on this, or is it just that, is it set that side?
Yeah, it's just quite a big table, unfortunately.
Yeah.
There is more detail in the actual report itself rather than the slide. But yeah, so it would have been 24.2 million. It has been reduced down to about 14.9 million as a prediction, which is about 8% of the budget. Penny will talk through some a little bit more detail. Some of the mitigations have been put in place. So from an adult social care operations perspective, that's currently looking at £5.3 million overspend. As Councillor Wakefield has said, 90% of the budget is mainly placement costs. So more costs and with a lot of pressure within the market, and also numbers. There has been an increase in delivery of home care, which is obviously good news, but that has come at a cost of about £2.8 million overspend. From a mental health perspective, that's currently looking at a £1 million overspend, but there are some additional high cost placements, which have caused the overspend in that area. Learning disabilities, the supported living area, there has been some more placements. Obviously, it is good to have people in supported living, but that does cost a considerable amount of money. And certainly since COVID, there's been a higher activity in daycare for respite, allowing carers obviously some respite. And then finally, as Councillor Wakefield has mentioned, commissioning. hasn't quite made the savings we expect for 23-24. We're hoping for further savings in 24-25. I'll just hand over to Penny to talk through some of the issues.
Okay, so for those of you who don't know me, my name is Penny Gower. I'm the Finance Service Manager for Adults and Public Health. As previously discussed at this meeting, there's been various in-year mitigations to reduce the projected overspend by 9.3 million. That includes 2 sets of one-off funding, one from the NHS money, and again, the NHS ICB have agreed to fund our care home blocks. That will end this year up to 23-24. From 24-25, the council will be picking up the cost of those home care blocks going forward. We've received some money for the Market Sustainability Fund, 3.7 million. We've reduced voids within ECH and supported living of 0.3 million. We've been reviewing mental health high cost placements. We've managed to reduce that by 0.4 million. We've also been reviewing continuing healthcare, focusing on that and bringing in extra income from that source of 0.5 million. The Emily's team have been carrying out reviews of high cost placements and have managed to bring that down by £1 million within the year. We've also been reviewing interim placements, so those that were placed when they came out of hospital and they've still been in an interim, a short-term placement, but we've managed to review those and reduce that down by 0.2 million, either by moving them into a long-term, some sort of long-term care, or the package has ended because they've no longer needed that support. We've also reviewed all the extra one-to-one reviews, the one-to-one care provided, and that's reduced that by 0.2 million. And then by picking up some of the overdue reviews, there's also saved 0.5 million. Are there any questions?
I'll start it off if I may. And the overdue reviews, they seem to still be very high. And that concerns me from all the reports. That seems really, really high. And I'm just wondering what we're doing about that. Yeah, please. I'm so sorry you didn't get my.
That's right. We can say that. So for those of you who don't know me, I'm Emily Fulbrook. Just to say, I am quite concerned myself, Jill, surrounding the reviews. But we do have we've got plans in place for across all of the neighbourhood teams as well. So they are doing some targeted work surrounding our overdue care act assessments and our overdue reviews. And we're looking at various different mitigations at the moment. So some of those include trusted provider reviews as well to be undertaken. But we're regularly monitoring that on an ongoing basis. So yeah, we do have, alongside most local authorities up and down the country at the moment will have significant challenges in terms of their reviews and care act assessments. It also leads on in terms of our workforce and the prioritisation in terms of and the managing the risk in terms of those individuals as well.
Would it be possible for us to have a feedback on that on where we are next meeting? I'd like a full report on the reviews, if that was okay, please. Where we are, like, what measures, perhaps in a bit more depth, would that be okay?
Yeah, more than happy. We touch on a little bit on the performance report, but I can absolutely do a much more in-depth look at the assessments. I think both the assessments and the reviews as well together would be beneficial.
Yes, you're absolutely right. The other thing, before anyone else, because I said about it, can you just expand a little bit on the blocks, the care home blocks that you mentioned, because I think that's needs a bit of expansion, please.
Okay, so should we pick that one up for you? One of us will do that. In terms of block contracts, what we do have is block contracts with providers, so that those beds are available and ready for us at a price that we can afford. What we've wanted to do is reduce some of those and really look at what do we need, where do we need them. And if you reduce them at blocks, you take that money out. But we're trying to spread that around the system. So it is about actually what do we need where, how are we utilising it, what is the utilisation of those, because we want that utilisation to be right up in the 95-98% of that. And that's what we're talking about in that space.
Okay, thank you. Members, is there any questions about the budget? Finance, anything at all? Councillor Ovier.
Yeah, thank you, Chair. I was interested, obviously we've sort of got through the budget process for this year, but I'd be interested to sort of get now or someone else's view going forward, because we've already heard, I think, one funding source is going to be taken out, which is quite a significant one. And as you know, Sarah said in her introduction, you know, we are demand led in this, and I'd really just like to, at this stage, you know, perhaps get a forward look to what the next year looks like, because that to me is the most pressing concern, and I think it is for the council as a whole, but also for obviously adult services as well. Thank you.
So you will realise as part of the budget setting that we have a large increase into this budget. But you're right, it's a demand-led budget. And what we always know is we predicted as well as we can. So for the first year, for many years, we have reset this budget to people. So we'll be able to monitor and manage this on X people are in, X people leave the system, and new people come in. So we will be able to monitor this really, really closely. There are always some risks, and I think, you know, let's identify those risks so you hear them here today. There's a risk of, we have a really solid domiciliary care market and a market that is managing all of our placements and all of our provision at the moment. And that market has got a number of international recruits as part of that. The law has changed in international recruitment, and people are now not able to bring their spouses into this country. That may, question mark, have an impact on new people joining the system. It's really interesting. I had a really good conversation with Brunel Care this week. And because we're now paying, particularly for our domiciliary care, a price that is good, a price that enables people to pay the living wage for those individuals, they're seeing not only the need for international recruits, but slowly the market coming up for other people that want to join our market. And they're seeing a mix. So I'm hoping that mitigation will help us, but that is one risk. The other risk is failure in a market. So if you will have all heard of 2 care home question mark possible closures that we had announced to us, we know year on year we have 6, 7 homes that fail or choose not to continue on. And if a huge company went in that space, that would be a risk to us. So what we do as part of this budget is say, okay, this is what we know, and we based it on predictive data from before, so new people into services, how many people die, how many people leave our services. We do all of that as part of this process, and we say, right, this is our best estimate based on trend data that we've got, but there are always risks. I don't know that a family may come to Somerset who has a young person or a person with found or multiple learning disabilities. I can't budget for that because I don't know. So there is always an unknown, and that can cost us £700,000, £800,000, £1 million a year. So we do have to so we haven't got in this budget any wriggle room. So it is based on exactly what we've got now, what we know now, what the demand we think is coming forward. So I am hoping with a good wind and everything going in the way we need it to do, that actually we'll get there. But if there's a change in legislation, or if there's other things that happen, then we'll be able to bring that to you. We'll be able to really identify that now. We are monitoring and managing these budgets like never before, so we should be able to track and trace that going forward. Do you want to talk your model as well?
Yep. So in terms of the model, well, I think it's the best model we've ever designed. But no, Bevan is right. We can actually now track by individuals. So and the model's actually been scrutinised by 4 external companies. So we've had Newton have looked at it, People 2 have looked at it, Peter Robinson's looked at it, who is an external consultant that's come in, and so have the LGA. So we're all confident in the model that I have produced. But like Mel said, we can then track everyone going forward. And I think it's also worth noting, we've seen an increase in capital drops. So that's a risk. So those are where people have been self-funding previously, and then their capital has dropped below 23,250. Over the last couple of years, we have started to see that trend increasing. So that's also worth noting, because again, we aren't aware of every self-funder that's out there. So while I do my best, or we do our best to predict who's going to come through, there is that risk there, as we see that costs are increasing for that self-funder market.
And if I can just come in on that point, so nationally it's an issue for us that we know, and Birmingham University are just starting to do a piece of work for the LGAA, DAS and ourselves to actually think this through and look at it. So what we know is that so I'll give you an example this year. So we've given a 3.2% rise to our residential care providers. the cost of care has gone up probably between 8% and 9%. So what they're having to do is pass that on to the private customer. So we know across the country and in Somerset that our private customers' percentage increase is probably between 8% and 15%. So what that does then is it reduces the amount of money they have, capital they have themselves. So they have capital depletion, which goes below that 23 or 23,250. I can never get that in my head. 23,250. So it reduces below that. Therefore, they are self-funders. So you will all hear, and I know there's cases currently where we're actually having to help people to move because we can't continue to pay the price of that care home. And if that care home won't negotiate with us a fee price that is something that we can afford, which is at our fee rate, I'm really sadly saying that that individual needs to move. And that is quite uncomfortable, but we try to do that. So you will hear that going on out there day in, day out, where it does happen. And that's the reality of where we are as a system.
But Mel, just before I bring in a couple of people first, but when you say that, where did that person go then?
So they will go to another care home because they can't go home because they've probably sold their home. They've done everything in that space. So what they'll go to is another care home that meets our fee rate. And we do have care homes that are absolutely able to take our fee rates. There's a number of them across the county, lots of them that are taking our fee rate. So that's where they'll go. They'll go to a home. That doesn't mean to say it's still in their area. None of that is, what we have said to you on many occasions is it's around 30-mile radius. So we are looking at homes around a 30-mile radius. We try to get people as close as we can for a price that we can afford. But there is a price that we get people's needs. As long as a care home can meet that individual's needs at a price that we can fund, then that's what we have to do.
Let's put the energy perhaps in the future. Maybe we need to put the energy in the future into making sure these people don't go in a care home. Maybe we get them care home. And that's a big transition, but I need to bring Councillor Woods in if I may. And this is relevant to this, is it? Okay, Councillor Wakeford.
Yeah, I just wanted to say about the future, because it is important how this goes forward. What we need in this county is homes in the right place. And so care home owners will say, I'm just building a new care home. They're building one, I think, on the Wellington Road at the moment, so they've got planning permission to do it in that new estate. But, for us, we need to shape this through the local plan process. We need these care homes in the right place. It's no good if somebody's saying, I want my relative to stay in Chard, if there isn't a care home working in Chard, or if there isn't one that's available in Chard. So we need to work out across the county when we're doing our local plan. We will be doing this. I want you to all be aware that we're part of it, and hopefully this committee will contribute to that as well. We'll be looking for homes in the right place, of the right type, and I'm sure you all know this, but I'm new to this, so I'm terribly excited about the things I'm learning. But care homes are changing. They are not just places where you go to live. They are places where you go if you really need care. So they're nursing places and they're dementia homes. Mostly, we are keeping so many more people at home because that's where they want to be, and that's the way the market's going, and that's what we need to build in as well. So you should be, optimistic about what's happening. It's a good trend. But it is expensive all the way around. But people in a care home generally cost more than people who stay at home. Not always, but generally. So I just wanted to point that out. And finally, also, this thing about the capital drop down to 23,250. Be aware that people arrange their affairs so that they don't have to pay. They will make whatever changes they need to make, put the home in the name of the children, whatever. You have to do it, I think, up to 7 years before to get away with it. It's rather like when you're arranging your affairs for inheritance. But just be aware that is happening. People know about it. They are doing it. We will chase up if we think they've done it just before the person gets to that stage. But it's difficult to chase up. So just be aware that's another thing that's going on and possibly needs legislation. Thank you.
And I think that needs a whole new conversation as well, a separate conversation, because not everyone's on the same page. Councillor Woods.
Yes, Mel, you touched on international recruitment. Are you aware how this impacts on care homes? Because you might be doing international recruitment, but the care homes are also doing that and they're following your lead. Do you have any knowledge of that?
Yes, of course we do. And we work in partnership with our care providers. We absolutely and rightly what that has enabled them to do by doing international recruitment, both for our domiciliary care providers and for our residential nursing care providers, for our supported living for people with a learning disability. Everybody has done quite a lot of international recruitment. It is fantastic that people have wanted to come to this country to work, and a lot of the 99% of those people are doing a fantastic job. So yes, we are supporting our providers in that space. We've also gone out and done a survey with all of our providers to just check how they're feeling about it. Have they managed to do it? Do they understand it? Because it's quite a logistical process to go through to get a license and keep a license. So we are working with them. There will be a site coming up, if it's not already there, in the next few days for all of our, is it there now? Thank you. And for all of our providers, which actually just tells them exactly what they can do, all on one place, all on the same place, just to help them to make sure they are legal, and that's going forward. So yes, so it's great, and I welcome it. And what it does is it continues to increase that supply in our market.
Thank you very much. Oh, sorry, Councillor Woods.
Yeah, just to be aware that if you're recruiting for social workers, is one thing. If you're recruiting for carers, it's an awfully low, how much they get paid is very low. And if you're recruiting that internationally, they must be aware of how low that amount is once they get settled.
As part of the deal coming over, they know exactly how much they're going to get paid. Yes, you're obviously right. It's probably a lot more than they're getting paid anywhere else. And talking to some of those recruits, what they're finding is they're able to send money home, which is one of the reasons they come here to do that, which is absolutely great. It means all economies start to grow a little, and that's what we want as a nation, I'm sure.
Absolutely. Thank you very much. Councillor Oakes.
Thank you, Chair. I've actually got 4 different points to make. On the sponsorship issue, the concern I have, just to remind members that I manage a care home. I have a number of staff who've come from other countries, and our main test is their use of the English language in a dementia setting that's highly appropriate. And we have some excellent staff who've come around the world. What I would like to know is, with the change and the increased difficulty of bringing in partners, spouses, do we know how many people are working within our homes, etc., who are partners? Because I have had a number of people, and I employ staff who are allowed to work in this country because their partner is sponsored. Now, if those people are not going to be coming in, that will affect the service. So the only way that you, I think, could work that out would be if we knew how many partners, and so they're not sponsored, but the partners are sponsored people are actually working within our sector. That'd be my first point. I think Mel wants to come back on.
So we're working really hard with the Home Office to help us in this space. It's probably not been the best scheme, let's be honest here, the best scheme in the world in terms of how they've tracked, how they've delivered it. There is a lot of work going on with them at the moment about how they can do that differently. So we're doing our best in Somerset, but what I won't know, and there is no data from them at this moment in time, which enables me to tell me how many people are sponsored within Somerset. So I don't know from the data that the Home Office have or haven't got to tell me that. However, that's why we put our survey out. So for those that we commission, I'll be able to give you that information quite happily. What I can't give you is where we don't commission or don't know those services, because people can do that and they don't need to be part of our services. So there's a real debate going on. Both ADAS, the LGA are working really hard with Department of Health and with our Home Office to try and get this process in a slightly different place than it currently is. But yes, it's a risk, and I can't do much more than do the work that we can do to get that in the best place possible.
Thank you, Mel. The issue around the moving of residents based on, just so members are aware, there is a very real risk to moving people who are settled within care homes. And actually, just so we're clear, I'm hoping, and I'm sure Somerset won't trip over this, there has been a judicial review on the moving of people. It is unlawful was the judgment, to move people from a care home to another care home where they are settled. Now, I think it was Oldham, and the Oldham case, it applied to someone who'd been in their home for 2 years. Then their money's reduced, and moving them after that purely on financial grounds was judged to be unlawful. We don't want to be in a position where we're on the wrong side of the law on this, and I would expect us to be challenged if we seek to do that. So far, in my experience, the right decisions are being made. It is different if someone's been in a home for 12 weeks or whatever, but after 2 years, and the Human Rights Act is considered to be their home. Just kind of some members, it isn't just a financial thing, it's more complex for our staff to have to figure this out, and we can't just do it trying to save money.
So I'm very fully aware of the Oldham case, as we would be, because we're all used to that. What we have to look at is where that individual's needs can be met. If that person has capacity, how we have good conversations with them about what we do, how we offer that family to do a top up if they can do that. We do all sorts of things to try and do that, to make sure that we are legal as we take this forward. And the Oldham gave us some quite clear points to look at to make sure that we don't. To make sure that we can ensure that we're not illegal going forward. So that's what we do as part of that whole process.
Thank you. And my third point was just to make an emphasis about respite. Whilst wanting to drive down costs, can the one budget line we overspend on, please, be respite? Because the savings that you make long-term are considerably greater. Someone being supported through the respite scheme, I'd like to see it refreshed. The respite scheme keeps people in their homes a lot longer, and longer in some ways probably than home care. But there needs to be that tool within our locker. And if you spend in that area, you delay someone coming into homes possibly up to 1 or 2 years. So that's significant money. So please let's not drive that particular line down too far.
So I don't think any line is, what we do, so you'll see lines in the budget, but what we'll also see is trend changes. So for me, my bottom line is the right number. And that means I understand why, because we've offered Fred, Jane and Sarah a lot of respite, but actually that's delayed them coming into care. You'll see that the care number come down, so you'll see that number reduce and that number come up. As long as we're balanced at the bottom, we're okay. And as long as we can understand the why, because that's what I would expect you to be saying to me, why is that line going up and that line coming down? And we can say, well, we can see those 3 people we've done this with, therefore they're not in care, you'll be fine. So I think that's the way I would expect us to be managing this budget.
Thank you very much. Thank you very much, guys. Yeah.
I have one more.
Well, I'm going to come back to you because I'm just, if you don't mind.
Yeah.
As we know, Councillor Lawrence has been very unwell. She's doing remarkably well. Don't normally do this. But I think we...
Thank you very much. Great conversation. Of course, we haven't spoken about it, but we're all aware that this is the 1947 baby boom that is now 77, and there's an awful lot of us. And for many years to come, this figure will be high. So it's going to be pressure on just about everything. And one of the things I've discovered, quite obviously, is that my home isn't particularly suitable for me and won't always be suitable for me. But where do I move to? Where is the planning on suitable, small, comfortable homes in suitable parts of towns and villages? We don't seem to have kept up building these accommodation areas that can be supportive living. And I think we're missing the importance of planning for future generations who will be living longer. We all get treated well by the NHS. We all get repaired well by the NHS. And then we can't live necessarily where we've always lived because that isn't suitable accommodation. So it's not for today, but for the long term, I wish we could get a bit more thought into where we could make some changes in our planning system that allows us to be ahead of the situation that we're in now.
Thank you, Councillor Lawrence. We can certainly see that the NHS have worked on you and you are looking very, very fit and very well, and that's marvellous. One thing I wanted to say to you is how long you and I sat on the Health and Wellbeing Board, And we talked long and hard about Fit for My Future then, and about preparing for the future, and about changing our homes so they were better for us. So obviously, it's something that you and I should have took more attention to, because I'm in the changing my home now to make life better. But I'm going to hand you over to the expert, Mel.
Well, I'm not sure I'm an expert in this area, but we will be. I think what we're looking at is the possibilities in this area have been really enhanced by the fact that we're now a unitary authority. So how is housing and care really linked together? And what is our planning for the future? So over the next 6 months, you should really see a very clear housing and care strategy coming into fruition. And I will want to get your support in helping us to develop that, so that we have a really clear plan that fits into then your local plans and your area plans. So we're clear about what we have, what we need, and it isn't just about residential nursing care provision, it's about what is the housing model for the future. It's really interesting. I had a really good conversation with another provider the other day around extra care housing. And what does that look like? There's some really good new models of intergenerational housing that are around this country. We need to learn from that. We need to pull them into Somerset. And that doesn't mean to say we fund them. It's about how do we get money elsewhere to help us with the bills and then the build and then the right support. So we'll be working that through, and we'll be using you as a team to help us with that and others.
Thank you very much. And I will say, we'll plug the old Sedgemoor District Council. We were doing Homes for Life, and we were building Homes for Life, and we'd started a lot. And it did make you think about your future, because I do think as well that we've got to learn that some of this is our responsibility, that we've actually got to prepare for old age. I mean, when you're only 18, like myself, it's fine, but you need to prepare, Okay, Councillor Osborne.
Thank you. Well, as someone who's probably keeps saying, well, I'm 21 again, but I was born at the back end of the baby boom to such an extent that I think I have to wait another 12 months for my pension. But it's just picking up on some of the things on planning and that Sarah commented. We had a case, funny enough, in Chard, where we had a site that was going to be a nursing home. The developer went bust, handed it on to somebody else, and they decided they didn't want to build a nursing home anymore. They wanted to put houses there. As it happened, it was a social housing provider. And we certainly gave them a hard time, and the evidence was produced to say, well, no one wanted to buy the site at that price because no one really wanted to build a nursing home. Therefore, we can't sell it. It's not viable. Therefore, we're going to put it back into the housing. So it's fine. It's all well and good having it in the local plan. But at the end of the day, it's down to developers to build what they want. And we all know the games and the evidence and the paperwork that developers do. And it's very frustrating when you find yourself having to vote for something, but you don't really want to, because you know full done well you don't stand a chance at appeal. The local plan, I think you're right, Sarah, it's a great opportunity to build in what we want. And people are starting to ask and have conversations about, I'd like to stay where I am. I don't like rattling around in a big house anymore, but there's nowhere for me to downsize to. But the problem we have in South Somerset is our local plan is shot. It's failed miserably. We don't have a 5-year land supply. In fact, it's down to less than 3 years. And that is giving developers carte blanche to do what they want. So instead of getting those sorts of houses, we are finding the developers coming forward. And we had a case in Horton just last week where we basically got more or less railroaded by the chairman into passing it. I didn't support it, and it went through on a chair's casting vote. But the bulk of the houses they wanted to build on that site, knowing the developer, were 4-bedroom gin palaces, which are not designed for local people. Those are for people who want to flee to the southeast, from the southeast or the Midlands, because we're a nice place to retire to. So they're not building for local people. They're not providing what we want. And there's very little at the moment we can do about it. That particular developer, they actually like to build nice big houses, which are definitely designed more for people to come into the county than what local people can actually afford to buy. So there's an enormous amount of work, and it's a massive, massive challenge. I'm involved with Persimmon at the moment, and the feedback that's coming back is actually people do want houses to downsize into because they're well aware they're sitting in a large house, but there isn't somewhere to keep them into the community that's small enough that can be adapted for that older stage. Funnily enough, the house I'm living in at the moment, it was occupied by an elderly resident who had had it converted some of the things done to make it suitable for elder. So it has a wet room. We don't have a bath, unfortunately. We've got a shower, but it's one of those walk-in ones with a frame and there's grab rails. And it is downstairs. So potentially I could stay there, but not everybody has that. And at some point that facility is going to wear out and it's going to need replacing. I'm not rich. So what happens then when people need those facilities and they haven't got the money, and they're having to decarbonise as well. So there is a whole massive piece of work around that. Not a conversation for today, but I think it is.
Do you have a question, Councillor Osborne? Is there a question there?
It
Or?
was more an observation as to
Yeah.
where do we fit this in to our work plan, so as we are aware of that, and what is the mechanism that this committee is going to use to feed into the local plan process overall.
Okay, thank you very much for that. I need to go down to this first, Councillor Waitwell. I'll just come back to you. Otherwise they're gonna shoot me. Councillor Pearlstone.
Thank you. So I'm going to turn the conversation back to something that Graham sparked my thoughts. Respite care.
Yeah.
You have, is it bank beds that you pay a certain amount for to keep them empty? How are they utilised with respite care systems? Can they be utilised for sort of almost a long-term respite care sort of system for, I know they're a bit ad hoc, but you know, for people that you know are caring, you've got somebody there who could utilise the respite care. Therefore, those are a couple of places where on a monthly basis they can have a night or two where there's likely to be a bank bed, is it, I suppose?
So block beds, some of our
Block
block
beds,
beds,
sorry.
some of our block beds may be used for respite, but not generally. It isn't the general rule that we have. However, we do have different options, and not everybody wants to go to a care home for respite. So that was something I'd really like to do, is go to a care home for respite, not really. And our younger people with a learning disability, you know, they may be living in the family home, but they don't really want to be picked up and dropped with lots of other people they don't know. There's a lot of different ways that you can deliver respite for individuals, but there is, and sometimes necessarily is, an option of somebody going to a care home for that. So we have a range of options out there. We continue to grow that range of options so that people can have a choice of how they want to deliver that respite. But yes, sometimes we use the beds that we've got.
Thank you. Councillor Wakefield.
I just wanted to reply to what Councillor Sir Osborne was saying, really. Two things. One is, I'm sure she knows, we have a commission provider who does do alterations on homes, which works quite well actually for people to stay in their homes. If you have enough money, you sometimes have to contribute towards it, or they might put a charge on the house while they do the work to make sure that you perhaps stay there for 10 years and they can claim the money back when the house is eventually sold. So that's the first thing. The second thing is, please, well, everybody on this committee who's got any say with their MP, go back to government and say, do something about the 5-year housing supply problem in Somerset. It's phosphates that's caused it primarily, and we need the government to act. We've asked them to do it. Please don't let us have to let these developments through simply because we are held up because of phosphates. They haven't agreed to do it, but it's a government thing that they could do, and they should do it now.
Thank you very much. Good point raised. Councillor Bruce.
Thank you, Chair. Bringing it back specifically to the items of the budget that we're looking at. If it's possible to have a bit more information about the 5.4. You mentioned additional costs within the intermediate care model have been identified, discussions going on with the integrated care board. Where in the budget do I find that? Are those costs kind of spread in the different sections? Is that into additional costs in the budget? Can I see it somewhere? What are the discussions that are happening and where are they going? Thank you.
Really good question. I'm glad you picked it up. So where we are at the moment is we have an intermediate care budget paid out of our Better Care Fund, which is in this in different lines but not spread out. What we know that's happened this year is that we've got more beds than we need because we've had to move people out of hospital, so therefore we've got quite a lot of beds. We've reduced those beds over the year, and when you have a conversation a bit later on our Life by Future, that is all about a lot about our reablement and how we work in reablement. There is about a £5 million just over of cost additional cost in that, and we're working with the ICB about saying, okay, how do we split this? What does that split look like? It's just a little bit more than that, because there's some, from a health point of view, there's some end of life care also attached to this, because actually when somebody leaves hospital, sometimes they need a bed, which we put into our intermediate care model, which is, and we know that they're going to pass away in that bed pretty quickly. So there's some nuances in this. We have built in just over 3 million already into this budget, assuming that that will be our contribution. Why we've highlighted it here is if we can't get that negotiation right, does it change our end year figure? And we are having those negotiations with them at the moment about what's theirs, what's ours. Where we are for the future, and I want to make sure for next year's budget, I'm not still having this conversation at this moment in time, but we've nailed it. So part of our intermediate care, we've looked at one of the chief execs from the chief exec from the CUNT being the lead and responsible for that. We also need to make sure our Section 75 agreement is really clear about what this looks like, how many beds we've bought. If it goes over, how do we make sure that we collectively have a budget to be able to deliver against that? So a little sentence for lots of things. We're more than happy to come back and really explain our intermediate care budget, show our better care fund to you and how that's being spent, because I think that's an area that is in here really hidden. And I think it's something that you would like to ask me about.
Yes,
I was going to say, sorry, Jill, from next year, we're changing the budget report for adults. So at the moment, intermediate care is within the commissioning line. So it's truly hidden at the moment. So we're going to be changing that commissioning so you'll be able to see and highlight, we'll be able to highlight intermediate care as that being one of the key areas. So we'll get that be a change.
Sorry, Section 75, probably I should have explained it. Section 75 is a contractual agreement between health and ourselves that we work with very closely. It's about a pool budget arrangement. How do we put that in? Who then, if it goes over, how do we split it? What does that look like? We need to just tighten that up.
I think I do agree. I think that would be a separate issue on the intermediate care. It would be a really good thing for us if we can have that as a separate item, please, because I think that's really important. I think we need to expand on that and understand. I think we're seeing that in there, but I mean, there's a lot of trust here, because we know, things will be, but I think we need to understand it much better. Absolutely. I would like to ask a really ridiculous question now, but then I can, I'm allowed, I've done it before, as you know. Is there any way that we can cap care homes? Because I was very concerned when Graham mentioned the point about how difficult it is for people that don't have the money and they don't come under your umbrella, so they actually have to be moved to another care home to meet their needs. That is absolutely. So many people have told me about this, and I'm very, very concerned. Is there any legislation that could come in? Is it a possibility or not?
No. There isn't at the moment. If you looked at, I suppose that's what the fair cost of care exercise was trying to do. And what that did was try to level up between what we pay and what a private supplier pays, so that actually that doesn't happen. There is a real cost to that. So let's not be, they trialed it in 5 authorities. We always knew there was a huge cost. That proved a new cost. And then the legislation stopped. Changing how we fund social care for the future has to be something that some government, whatever colour it is, takes on. But it ain't going to be in the next 5 years, whoever comes in. So let's be honest, it's a problem for us. It will continue to be a problem for us for some time. And I think, if you look at the manifestos that are out there and being non-political in that, none of them have nailed it in the next term.
Okay, well, I'm glad I asked that ridiculous question, because it wasn't so ridiculous after all. Okay, I think we've talked about this now. I think we need to move on time-wise. Obviously, it's a very, very pertinent, and the 2 areas that we're going to bring back, we would like more expansion on the better care budget in line with the expanded, because I think those are the areas where we love them, and the intermediate, we want them on the next agenda. Okay, that's fine. We've agreed to that. Okay, now we go to the exciting bit as well. The other thing I was just going to add to that, though, we bought a very small bungalow in 1969, which I was always embarrassed when friends came round and we were always squeezed up together. Now my husband and I are saying, good job. Because now, it meets our elderly needs. So there is something to be said. And I wish they would come back and build more bungalows. I think that would be a lot of an answer for a lot, but developers don't like that because a bungalow takes more ground, we know. But I think it's a good point that they ought to be thinking about this. Okay, item 7 is my life, my future.
About the recommendation. Sorry, do you do that? I mean, the recommendations say scrutiny is asked to consider. Do you make recommendations?
Well,
at
we're
this
not,
point?
we're going to, what we're going to do is bring those back to the next, we don't bring up recommendation on the budget, do we? We don't do anything on the budget. Because they answer all of our questions, we scrutinise them deeply. So I think, but those 2 areas where we feel we need more information on will be brought back to the next meeting, next agenda. Oh, I do apologise, Councillor Stanton. Sorry. You've just snuck in.
Thank you, Chair. Yeah, I just wanted to pick up on the remark you just made about we need to build more bungalows. If you talk to people who specialise in keeping older people fit, they will say very clearly, don't move to a bungalow if you're fit enough to get up and down stairs. I mean, I time myself on it. I'm in the same generation as lots of other people on the committee. 8, 10 times up and down the stairs. That is built into the day. That's a way of keeping fit. So bungalows need to be carefully, the idea needs to be carefully applied only to people who have got to a state of unfitness where they can't cope with stairs. Otherwise, please let's stick to a policy of having stairs. Thanks.
I think if I may say, Councillor Stanton, you and I are going to disagree on that. My surgeon just recently told me, do not go up and down the stairs, avoid them at all costs. So I think it's an area where we'll all have a different opinion on. But anyway, thank you for that. Item 7, my life, my future, adult social care transformation programme. And this is over again to Mel and Emily. Emily first, is it, or Mel?
So what we've got here is I don't know if first is Sarah wanted to say anything or not on this.
Just wanted to say it's something actually, just about the whole My Life, My Future and the whole programme that Newton have come with. Just think about it. If you are working in a very busy department as this is, close to the coalface, how often do you step back and have a look at it and say, actually, I could be working in that area over there. I didn't see that before. I was also thinking about a book by John Berger called Ways of Seeing. This is another way of seeing what we are doing. And this is what Newton are bringing to us. So when people have said to me, are we doing anything different than we would otherwise have done? What they're doing is bringing a way of seeing it, where the problem that we've got or the problems that we deal with in adult social care. So I do want people to think of it like that as a bit of a step back. They have also brought very good ways of looking at data, ways of using our data that we haven't been able to do. And that is making a difference to how we work. So I just wanted to put that in context before we start. That's okay.
So we have Emily online and Emily here, and they will take you through the presentation together. Sure.
And Emily, did you want to introduce yourself to the committee?
Yeah, hi everyone. My name is Emily Fowden. I'm part of the team at Newton Europe and leading on the My Life, My Future programme. Should I bring up the slides, Emily?
Yeah, if you can bring those up, that'd be great. Can you put them into slideshow?
Does that work?
For people, that's it, perfect, thank you. Okay, so Emily and I are going to take you through in terms of the this update for scrutiny. If we just go on a slide, Emily. So we've got some key areas that we want to cover. So just to provide an executive summary, we'll do a refresh on the programme and then just take you through some of the in focus items, so particularly for learning disabilities and preparing for adulthood. We'll also go through the finance benefits and tracking as well, and then updates surrounding any programme risks and also the trial updates. So if we go on to the next slide, Emily and I will do a sort of a double act on this, so we'll go through this together. But just in terms of the executive summary, so we're now 7 months into the programme. of working with Newton Europe as part of the My Life, My Future transformation programme. And we have got, as you're aware, we've got 5 work streams that are currently in place. And we're now moving, as we progress forward, we've done some of the design and the understanding, the diagnostics, and we're now moving into the implementation phase where we're looking at some of those trials that have been taking place in some of the in singular teams are now being rolled out across the county. So those new ways of working that have been trialled to sort of understand the implications and the benefits surrounding those are now being rolled out across. So what we are continuing to see some positive results across the service. So we've seen a 30% increase in the number of individuals accessing enablement. So that is pathway 1. So those individuals that are leaving hospital are now leaving hospital and they're going home through pathway 1. So 30% increase surrounding that is absolutely fantastic. Enabling more people, as we've been talking about, enabling more people to stay at home and live at home successfully. So essentially that's meaning we've got 15 more individuals every week and now benefiting for the chance to live more independent in their own homes. We've also seen a reduction in the volume of new care home hours and direct payment packages. So that's not to say that people aren't receiving care home hours or packages, it's the volume of the hours are reducing down. And that's being driven by both the work that we've been doing within our peer forums and also in terms of linking in with our community services as well. So our community and village agents have been a massive part of that as well. Our current performance run rate in our community-based supports is increasing as well, and what we're looking at is an overachievement in terms of some of the benefits, the financial benefits that we're experiencing there as well. So overall, the programme is on track and it's predicted to achieve the savings that we've identified. We are continuing to monitor that through our finance and performance monitoring group that meets on a fortnightly basis. And what we're looking at is making sure that we've got the right rigour in there. So we're making sure that all the performance reports are up to date, and it gives us the most up-to-date data as well. So there are some risks to maintaining the progress and ensuring the sustainability of the programme, which will be highlighted as we move through the slides. Emily, anything you want to cover on there at all?
No, I think all good.
Should we move on to the next one? So why are we doing this now? So essentially, we're seeking to build on the strengths that we already have in Somerset and to design and deliver high quality, person-centred adult social care services that promote independence and well-being for individuals within Somerset. So essentially that leads to having the right support at the right place at the right time. And throughout the My Life, My Future programme, we're looking at that person-centred work. We're looking at the data, the support mechanisms for our workforce. We're making sure that we're future focused. So if there's anything that we're putting into place now, we need to think about later on, further on down the line. And we're taking an interactive approach, particularly surrounding our data and visibility. Move on. So this is just a reminder in terms of the work streams that we've currently got. So there's 5 work streams that are in place. So we've got our reablement work stream. We've got our decision-making work stream. So that's really focusing into the new ways of working within some of our community-based teams as well. We've got progression and enablement. So that's very much working with individuals with a learning disability to really see how we can support those individuals to progress into much more independent settings or independent lives, moving away from those more residential restrictive provisions for somebody with a learning disability. We're looking at our preparing for adulthood approach as well. So doing a lot of joint working with children's social care. So we're much more informed surrounding young individuals transitioning through into adulthood. And a lot of work has been done on this. We've done various different joint scrutiny meetings surrounding this area of work in particular. And this update will provide a bit more of an in-depth overview surrounding the work that we're currently doing. And the other work stream is surrounding our data visibility as well. So I'm going to pass over to Emily because you'll be bored of my voice. So I'm going to pass over to Emily now.
Thanks. So I thought we'd just do a bit of an in-focus look at our learning disabilities and preparing for adulthood work streams. I thought we'd start with a case study of someone who, a real case that we've looked at as part of this work stream. So Stacey's a woman who's in her 30s, living with autism and a generalised anxiety disorder, and she lives with her mum and stepdad in Yeovil. She's become quite isolated in her home environment, and she hadn't been kind of doing any of the activities outside the home or really going out very much at all. In conversation with her family, her mum expressed that she's really interested in how the outside world works, but spends a lot of her time researching that kind of stuff online rather than really getting out into the community. So the social worker picked up her case, and initially the conversation was around we could definitely do something to help her build her confidence, to make more access, have more access to the community. And the initial plan was for 10 hours a week of support. One of the things that we've worked on in this work stream is our peer forum, and really having that kind of peer and group decision making, as Emily mentioned, bringing in some of those other voices like our community agents. So that social worker brought Stacey's case to that peer forum to say, I've got some thoughts, but really keen for some kind of peer challenge and group expertise and thinking. In that session, drawing on the experience of others in the room and some of those with different backgrounds, particularly thinking about that kind of community agent role, the plan was built up to support Stacey with 5 hours a week, but really supporting that targeting around her specific goals and the specific things that she wanted to get out of access to the community. So we left that peer forum session with a plan that felt better aligned to Stacey and her needs and her wants, and really thinking about improving her independence, but also with fewer hours of support than we'd initially thought to put in as well. So both the kind of double win of we've got a plan that's better suited to that individual, better focused on her independence, but also costing less in terms of that kind of home care hours and support for us. So that's just one of the examples of how those kind of peer forums work in action and how they're really changing those plans and support we put in for people. Wanted to then pick up on specifically around our preparing for adulthood work stream. So this is focusing on our young people who come at age 18 from children's services into adult services, and really wanting to make sure we get them the most independent outcome possible. Some of the things that we've been really thinking about, as Emily mentioned, that real joint working between children's and adults. So we know about these people, they are sat within our children's services teams. How do we get that really good working between the two? For us in adults, having visibility of that cohort that is early enough and complete and accurate visibility of that cohort well before they hit 18. So we know about them in this council as a whole, but do we have that really good visibility within our adults teams? Early planning, so that we start to understand that person's aspirations and needs well in advance of them turning 18, and completing any assessments required for that in a timely way. And then part of that planning, making sure we've got the right services or accommodation for those young people when they turn 18. And that's really about making sure that our commissioning team have enough time to find those appropriate placements. So really the focus here is joint working with children's and bringing a lot of that work earlier on in the process for those young people. So what have we started doing on the left? Working with children. So we've had our joint area meetings, escalation meetings, some real work on that data visibility of that cohort. We've done a big focus on making sure that everyone aged 17 and over has an allocated preparing for adulthood team member. And the productivity of that team in terms of the kind of care acts they're completing, I think the latest figures, it's been a 200% improvement in the productivity of that team. So getting through lots more of that kind of assessment work. And again, that clearer processes and working between the children's and adults team. And what you can see on the right is the average age at which our preparing for adulthood team complete the care act assessment for that young person. And what you can see is back earlier on in the year, we were kind of at over 20 years old. So that person's already turned to an adult, but we're not getting to that work till they're already 20. And we are back down. When we made these slides, the average age was 18.2. I think we're now at 18.00 something. So we are almost under 18 for the age that we're starting to complete those assessments. And it's really important that we get the adults' focus into that person earlier. It's a very different legislative framework between children's and adults. There's different entitlements. We've got different things to think about in our adults team. So the earlier we can get that adults input into that person, that young person's plan, their family's expectations, the better. What's next? One of the things that we're really keen to do to again focus that kind of joint and early planning is starting work on a new form that will sit in our system that allows us earlier to start logging some of that work for adults. So we want to have a form that sits in our Eclipse system that allows us and our adults worker to be enabling progress, updating the support requirements for that person and that person's kind of other key information. So we've got that sat within our systems in adults much earlier. And what that does is help our commissioning teams to have a forward view of that provision and support requirements that we're going to have when those people turn 18. But we know about it earlier, we can start thinking about it, we can start planning for it. It also then helps us with a bit of that third point on there, a kind of aim point around our conversations for that person. So again, the earlier we're thinking about it, the better we're setting expectations, the better we're doing that planning. And the last point, just really thinking about how we make that minimal extra work for our preparing for adulthood teams. How do we just get the technical bits right, that where that's relevant, we're pulling the information into the right forms and not creating kind of duplication and rework. So definitely more things to go in this area, but just wanted to touch on a bit of a more detailed look at some of the work we're doing in this area and seeing some really positive early results as well. And I think just a massive credit to the team in that area. Sarah, I think you mentioned at the start some of the different ways of looking at things, and just giving the team some of the visibility of the data has driven massive change in how they're working and how they're approaching it. And I think fair to say it's felt a really positive step for that team. They're seeing that graph of the age we're working with people coming down, and they're getting a lot of the kind of positive reinforcement from that as well. So it's been a really positive few months in that team. Do you want me to carry on for the financial bit, Emily, as well?
Yes, please, Emily.
Yeah. So I think people will have seen this slide or a similar version of this slide quite a few times. So this is our opportunity matrix along the top that came from the diagnostic. So you'll recognise those 4 work streams, and then the target and the stretch value. So that is the value that we think we can have on our long-term care spend annualised by doing the work in those areas. The target view was our kind of what did we want to get to, and we had a stretch value there that was with a fair wind, if lots of things go our way and if we get some of those more stretching opportunities in, where do we think we could get to? What you'll know is that that value is around how do we impact our long-term care spend, and so we don't get all of that value the minute we make a decision. The easiest one to conceptualise is if we avoid someone going to residential care, we're getting that saving over a number of weeks and months that they're staying at home. So we've got the profile at the bottom that says, how do those values actually accrue? We might make the decision on day 1, but we haven't got the full value of that decision till kind of 60 weeks down the line, once that person's been in a different placement for a long time. So we see a kind of accumulation of that benefit through time. And we obviously then we're thinking about the kind of year end of 23-24 and where are we looking for kind of financial year 24-25. So this slide then kind of is our summary of where we're at the moment. You'll see the work streams again on the left up to that total kind of value of 14.2 million. The middle chunk, the 2 columns in the middle, are our up to end of financial year 23-24 position, and the two on the right are our up to 24-25 end of kind of projected position. The 2 light green columns essentially say from where we're performing now, and this was, as you'll see at the bottom, the last kind of fully validated month of data we've got. So up to the end of 23, to December 23, if we held that position, held that current performance, where would our kind of accumulation of value be at the end of each of those financial years? And the teal columns are our targets. So I'll do the big numbers at the bottom, and then I'll talk through about how the work streams break down. So overall, we're looking that if we held that December 23 performance indefinitely, we're looking good for our overall target. So we're a few 100,000 over our end of 23-24 position, and looking to be a few million over our end of 24-25 position. So really positive news that the performance at our kind of last validated month is on a really strong trajectory. Obviously, there'd still be work to do to sustain that performance where it is, but it's in a good place. Starting to look at the how that breaks down by work stream, it's looking slightly different to how we initially profiled it. So particularly in those top ones, we're seeing more of our benefit come through our kind of community-based services route, and how we're avoiding some of those home care or direct payment packages. A lot of that through our reablement service. That's kind of significantly overperforming, and we're slightly underperforming where we'd wanted to be in terms of our residential care starts. But overall, that position is kind of balancing out to still being kind of in a good place overall. We're just seeing kind of slightly different nuances in how we get there. It's the ability to click on. There we go. The last bit then we thought we'd take through is just a bit of the programme plan and kind of where are we up to and what are some of our key risks going forward. I think one of the last sessions of these, we talked through some of the approach around that kind of having a trialing in a specific area, really knowing that we've seen the benefit of that trial, and then thinking about how do we iterate and make sure that that new way of working is adopted across the county. You'll see in a lot of these work streams towards kind of the spring, we are moving into that adoption and sustain phase. So we've done trials, we've seen the evidence of where those trials have worked, and some evidence of where those trials haven't worked and where we want to maybe change or scrap some of those things. But we're thinking about how do we pull all those trials together into a way of working that we then roll out across the county. So a lot of our focus at the moment is thinking about putting those things together and really getting that kind of sustainability of those things being bedded in and being business as usual within the teams. The red area on this programme plan, I'll come onto on the risk slide, but the one that we've probably slowed down or been behind the plan with is our data visibility and control, and a lot of that is around our kind of technical dashboard builds. So we've got ways of generating the visibility for our teams, but it's more manual and more kind of less technical than we'd like at the moment. So we're kind of working with some stopgap solutions which do the job for now, but we want to get caught up to that plan on some of our technical dashboard builds that will really help that sustainability. That's the top one on the risk slide that I've already touched on. So making sure that we've got the right data engineering capacity across the local authority, and making sure that we've got that kind of data engineering side really solid. The second risk on this, and I think Sarah, you touched on, it's a very busy service there's lots of stuff going on in the business as usual, let alone thinking about transformation. And we know that we've got a lot of demands on our staff, and just making sure that we really focus on how do we get the sustainability right for those individuals? How do we really empower and enable people to sustain these changes into the future once a lot of the programme infrastructure kind of steps away? Some of the mitigations we've got in that is really thinking about our training plans, making sure that we get enough resilience in those, we train enough people in new ways of working, thinking about where we've got pressure points in certain grades or certain services, but also just being a bit more flexible with how we pull certain individuals into bits of work as well. And then Mel, I think you touched on previously and some of the conversation around intermediate care. Particularly the reablement work stream has a really strong interface with our health colleagues, and just making sure that we've got the right governance and the right support in from those colleagues at the right time, I think has been on the risk log for the whole programme, and just making sure that we particularly get the right senior input and steer and making sure that sustainability will last across into our health colleagues as well as within the council. Oh no, I've got one more slide. This one, I won't go into loads of detail, but this one just kind of sets out, as I talked about, that really bringing those trials together and thinking about the kind of adoption and sustain. This is just a bit of a one-slider that summarises where our rollout plans are. So you'll see for each work stream, there's kind of 2 or 3 trials that we've got the evidence have been successful. And then we've got a plan and a date for when those are going to be rolled out across the whole county. So you'll see lots of work going on across March, April, May, in really rolling those things out. And then the next few months, the kind of summer months, will be about really bedding that in, making sure that that's sustainable and we can start to step some of the programme support away and those things do sustain into the future. I think the rest of the slides were kind of appendix ones, so I'll stop sharing and then go from there, unless Emily, there's anything you wanted to add on any of those last bits.
No, that's great. Thank you, Emily. Yeah, thank you.
Thank you very much, Emily. When I read this report, I had loads of questions written down, loads of questions, lots of yellow things. And you've always seemed to do this. You've done it before. You've answered them as I went along. I think the programme financial benefit summary is a really important piece of paper, or electronically look at that slide. That slide is absolutely crucial, I think, to understanding the elements of this. One of the things I just wanted to ask, and I had the question written down, is how do they value accrue benefit through time? And I think that's one of the questions that we've not been able to get any grip on. We don't know how this is all going. We have no, because this is something in time that you're not going to actually know and until a certain time level. And for us, we haven't got anything that we tangible that we can actually say this is working, this is not working. But one of the things I think that in this report for me is about the challenges of the VR process. And that might be something that we want to take to the executive as a recommendation to ensure that we retain, we don't lose valuable staff that will be needed to make sure that this whole process goes through seamlessly. The one thing that I'm concerned about was reading this report was actually how important that is. And I just want members to consider that, because it is an important factor. If we haven't got the main staff to be able to help, then we won't be able to do the job. So, okay, can I ask members, please, any questions? Oh, Councillor Osborne.
Thank you. Yes, this was a very useful, very helpful update. And thank you for the presentation, Emily and Emily. Couple of one's a very almost trivial one. On the programme plan, you've actually got some bits colour coded in grey there, but you haven't actually said what the grey means. I understand red, amber, green, but I'm not sure what the grey is meant to be telling me on there. The second one is, and I think Jill's touched on it as well, and it also comes up, I think, in the peer review initial report as well. The work stream data and control, that one's in red. And yet that is the bit that is going to provide you with the data so you can measure all the other things above it. And I think Jill's right, and I would support her on that also links into the transformation, whether we raise it now or as part of the peer review, is that there is a real possibility that what is happening in the wider world of transformation within the council could actually seriously undermine this piece of work. And without this piece of work, how are you then going to be able to implement and assess the progress of the other work streams, and that they are indeed delivering the outcomes that you want? I think that has to be a real cause of concern, and I think it's one of the key causes of concern that was picked up in the peer review part. In fact, these almost run together. So whether you want to pursue it with this one or as part of the peer review, I don't know. But, we're tending to think as well of the adult services transformation almost in isolation from what's going on with the rest of the council. But actually, what happens in the rest of the council could very well impact how well we can carry out our own transformation and deliver what we want to deliver. So I would support your recommendation, Jill.
Thank you.
Mel.
So inevitably, where we've got to save money as a council, that's otherwise we won't be able to manage it. Inevitably, whenever we have a VR out there and we lose staff, there is fragility in that. That's a given. However, within this programme change, one of the areas of concern for us is around that data and that data visibility, which we have taken to the corporate transformation board, and we are looking at how we manage that. There isn't a quick win on this space, because actually what we have to do, and Microsoft are working with us, is change the design. So our IT systems and our IT teams with Microsoft are looking at how we pull this together and actually do this differently for the future. As Emily said, at the moment we're managing it and we're looking at it, but actually we need a proper system that does that, and systems don't happen overnight. So it's in the pipeline, people are looking at it, they've got it, and a VR and moving people around isn't going to change that. We have got to get that in place. So there's always a corporate risk whenever we do a VR position, and there will be some change in spaces, and that's inevitable, and we just have to make sure that we highlight it wherever we need it, and we're clear about the corporate risk and our own risks. And I think this programme does it. We are absolutely part of the transformation programme that is sitting alongside this council. Adults and children have their own transformation programmes, but it is feeding into the overall programme of change that we've got in place.
Thank you. Oh, sorry, beg your pardon.
If any of you were asleep, you're awake now.
Thank you. Councillor Govia.
Yeah, thank you, Chair. Sorry, I'm a bit nearer. Thanks, Chair. A couple of quick questions, and I wonder if one of the Emily's could unpack on the it's page 56, the table you referred to, which is, I agree, is very helpful, the programme of financial benefit summary. I'd just like a little bit more information on the decision making, reduced starts in residential care, why that's not quite looking like it's going to make the potential benefit. And the second question, I'll get it in now, so you don't have to come back to me, Chair, is on the preparing for adulthood. I understand it must be easy for us to track the people, young people who are in the sort of Somerset system, but do we have an issue with those who are outside of the Somerset system and maybe living in Somerset but placed here by other local authorities, and how do we manage that effect when they turn 18 and then move into maybe using the services of our local community? Thank you, Chair.
Can I pick up the,
Yes.
I'll pick up the preparing for adulthood one first of all. So we are absolutely working in terms of being able to recognise and understand the individuals that are coming through to Somerset. So you're absolutely right. We've got much better understanding now, and we know about every 14-year-old now from an adult's point of view, which is absolutely brilliant, which is absolutely fantastic. It is those individuals that are placed here from outside of Somerset who potentially will impact, potentially from an adult's point of view, but also from a community point of view. We're quite limited in what we can do in that space as well. So the closer that we can link in with our providers so that they can be able to help us in identifying those individuals, the better, really. Councillor Govia, and we've got that really good linking in with our providers from both a children's point of view and also from an adult's point of view as well. Not all of those individuals will come through to adult social care when they're 18 or Somerset adult social care, but we're also linking quite heavily in with our colleagues within the ICB, particularly surrounding health funding, so health funding for children, and then when that changes into health funding for adults as well. So we've got regular catch-ups with individuals. So I meet with the continuing healthcare manager on a monthly basis, and then we also have our continuing healthcare steering group where we look at the data of those individuals as well.
So what we say is there's about at any one time around 700 people that are placed in Somerset by other councils. There's roughly about 700 to 800 people, and they will be being supported by our health services. So that's not us, because they're not ours. And the majority of those won't then end up funding us needing funding, because they'll go back home or they'll go wherever they need to go after that. So we know a proportion of them. I think that's probably as good as we can get in that space. We just don't know. However, what should happen when anybody is coming to Somerset, we should get notified of that. And there is a process of notification. That again doesn't always happen, but what we should do is the local authority, if it's the local authority, should be talking to me and saying, hang on a minute, I've got somebody that wants to come to Somerset, therefore we can take that person. However, if they brought them here, they should be supporting them here as well, unless they become ordinary residents of this authority. And there's quite a lot of legislation around that we work with and continue to work with. Thank you.
Thank you. Councillor Sully.
Oh,
First question, Jess.
I beg your pardon.
Should I pick up on the point around the residential care numbers?
Yes, please, yes.
Yeah. So it's a really good question. So some of the things we've been looking at is, are we seeing any differences between teams? And we're not seeing a particularly strong kind of local variation in that. One of the things that we are starting to look at in that piece of work to really think through, we've predominantly focused on our residential starts coming through our community teams. So one of the bits that we're kind of extending into over the next few weeks is really understanding how many of those residential starts come from our acute settings or our intermediate care settings, and just making sure we've got some of the same kind of processes, new ways of working that are feeding through into those different routes of getting into residential care. So it's the focus that we want to look at is more of our kind of, where are we seeing residential starts through intermediate care over the next few weeks. And just on the point that Councillor Osborne raised about the grey boxes on the programme plan, if it's the ones further on the right, it just means they haven't started yet rather than anything else.
Sorry. I think if you look at the national data in terms of people going into residential care, if you think of our older population, people going into residential care aren't going in till they're 85, 90-ish. But that is what we're seeing. So, although our trend is trying to get as low as possible, there will come a time, I'm sure, that actually it starts to creep up a bit, and we've just got to monitor and manage that in the right way. So, yeah, as long as we know the people, we all know the numbers, we've just got to make sure, firstly, we're doing all the processes right, and we're supporting as many people as we can at home, but also understanding, have we got the right processes in our hospital settings as well? Because if I came from home, unless I've had something catastrophic happen to me, I should be able to go back there. And how are we making sure that's part of all of our processes?
Thank you. Councillor Bruce.
So you missed that.
Councillor Sally, I didn't mean to do that, sorry.
No problem. Thank you, Chair. So I'm asking my question in the context of why I'm here, to represent my community, and we're all here. We're voted in to represent our communities. So we're asking questions on their behalf, and the answer is important to the people that aren't in the room. And I acknowledge how complex this area is and how hard you're all working. So what's presented today is process driven, data driven, result driven, cost savings, and it's very corporate. And I'm thinking of the people that we're talking about, and I would encourage that the language we use be less corporate. If I could influence that in any way, I don't want to irritate anybody, but I think it would help get across what you're doing and the level of success. So my question really is around the support in the right place at the right time, person-centered, that promotes well-being and independence, which is what I've heard. So the savings you're making, which of course is the success marker, is that aligned to care package support, reablement, where this support is 30 minutes visit for breakfast, dress, toilet? And my question is, are we putting caregivers under pressure? And how does it feel to receive that care? I genuinely don't know the answer, and I'm not looking to pick fault with what you're doing, but I've seen the other side of this as I've driven past somebody and had to stop and help them go to the toilet, and that half an hour to do stuff, that's the sort of negative stories we hear, and I just hope that we're not pushing in that direction. So that's my question, is that the success marker, that we're squeezing time for people that are in their homes after, say for example, hospital stay? Thank you.
The short answer would be no. So I'm as a social worker through and through, my priority is about making sure we get the right outcomes for people. If we do the right thing, the money it will follow. That's inevitable. That's what will happen. You're right in saying that we've got individuals receiving who live at home 30-minute calls. That's absolutely right. That does happen. However, there are also people living at home that receive an hour call as well. So it very much depends on the level of need for individuals and what outcomes we're looking at achieving. The providing the right support at the right time with the right place is absolutely a strategy from an adult social care point of view, and that's exactly what we would want to be doing. But what we need to make sure of is whatever support we're putting in place, it's all about meeting an individual outcome. So it is person-centered for that individual. So it's not a blanket approach. Not everybody receives a 30-minute call 3 times a day or 4 times a day. It very much depends. If somebody needs to have an hour, and actually that needs to mean that's 2 members of staff that need to go and support that individual, that's what we would do as well. What we would always want to do is make sure that we're providing the least restrictive care in place, and that it's not always about paid services. So it's also about looking at what else can be supported for that individual as well. So we're looking at that holistically, but also making sure that that is more sustainable for individuals as well. Absolutely take on your point as well in terms of it's a very corporate presentation. As part of the work that we are doing, making sure that we're doing the right thing for individuals, carers and family members is absolutely a high on my priority list. And we are making sure that we're getting that feedback from individuals so it's meaningful. So we're getting a lot of stories now that are being able to be generated. It very much feeds into the work that we're doing as part of our inspection as well. And making sure that we're not all sat here thinking we're doing a wonderful thing when in reality it may not be working for somebody. So we are making sure that we're getting the actual feedback from individuals, families and carers as well. Does that answer that for you?
That really does. Thank you very much. Thank you. Could I just add to, Councillor, sorry, I've had the same thing, exactly the same thing. Somebody very near me has said that their time has been squeezed, and they've got 30 minutes to get a gentleman that takes a long time to get to various personal issues done. And also it's been advertised, it's been brought out on a regular soap opera, how the social workers and special care packages don't meet the times. So what I would like to ask is, who scrutinises this? Who makes sure that individuals, we can have a data, but who scrutinises that to make sure it's correct?
So in terms of what would happen is somebody would have, if somebody contacted us and said, actually, I need to have some care and support, or feel like I need to have care and support, we would do what's called a care act assessment and then a support plan. We would then, so that would be a social worker that would end, or an adult social care practitioner that would end up completing that. What would then end up happening is that nothing is agreed in terms of from a peer forum point of view, or no funding is agreed until it's been to peer forum. When somebody is receiving that care and support, particularly if it's somebody that's new, we will always do that 28-day review to see how that's going, what's happening. Sometimes that will be a review in person. Sometimes that will be a review completed over the telephone. Sometimes that may well be a trusted provider review as well. The CQC will also do the Quality Commission. They will undertake their own review in terms of the quality of the provision that is being completed. And we've also got our own quality assurance team as well that will link in across all providers, be that within a residential or within home care as well.
Thank you, because sometimes it's people that haven't got anyone to speak up for them. Yeah. And that's the worry. I often wonder who scrutinises CQC, to be honest, and that might be something we need to bring in here as well. Okay, Councillor Bruce.
Thank you, Chair. Really interesting report. I have to say the one thing that was raising really red flags for me was the main risks highlighted at the end, which is regarding data and the lack of capacity of certain individuals. I'm a little bit confused because maybe I'm misunderstanding the wording, but the lack of data talks about the lack of resource within the data engineering function. And your response, Mel, was a bit like, don't worry, it's all in hand. The IT team are doing it. It doesn't happen overnight, but we're sorting it. But I'm concerned about, do we need to be doing something? We're talking earlier about recommendations to the executive and everything. How I want to highlight to the executive, this is an issue. If it is an issue, if it's, as you say, if it's all in hand and you're not worried about it, fine, let's go on that way. But I've got concerns that it's not in hand. Are we talking about resources in terms of people, or are we talking about the software? What are we talking about when we say resources here?
We're talking a mixture of, there's all, in this space, there's quite a lot of, there's maybe 2 people that can do this. And that's really fragile, isn't it? If there's only 2 people that can deliver this. So what they're trying to do at the moment is get more people able to run the system and make sure that system is consistent. So Microsoft will do that for us. A build time isn't quick. And therefore I am raising this everywhere we can. So that's why it goes, this red risk has gone to our corporate team. Everybody is aware of it. If you would like to raise it as a risk here to our execs, I would have no problem with that as well. It is highlighted everywhere, but if you as a scrutiny choose to do that as well, I would have no problem with that. I think that's absolutely fine. There is always a risk, isn't there, in this space? We've got to get this right. And I think one of the things that we've talked through is corporately, how do we do this? Have we got the skills and expertise currently in our teams to be able to do it? Or if we haven't, how do we build that? And our IT team are really clear about where we go and how we do it, but it is time and it is a risk.
Okay, can I?
Councillor Bruce, I think we're going to
come back on this, yeah. In that case, I would like to suggest that we do recommend to the executive that as they have an overall view of this and that they request a more detailed report into this to consider and see whether there are any actions that can be taken. I think it's something that we need to see come back. More importantly, executive need to be looking at this in detail.
Thank you. Thank you. I've already put some notes together for this. As I obviously mentioned at the beginning, and I think it's well worthy, but I will come back for, obviously it's point 2, where issues for consideration and to give in recommendations further. I'm going to go to Councillor Osborne first.
Thanks. I would certainly support what Councillor Bruce put there. I think she made a very clear and concise point, and I would quite happily like to see that within the recommendations. It's very fundamental. What I was going to ask, Mel, is when they're going through the VRs, we've been told that not all of the applications will be accepted. Will you have any sight of, in that process of deciding who is allowed to go and who isn't, so nobody slips the net who is vital to this process? Because what you don't want to find is that there is a yes from HR to a person going when it would be a no from you in terms of supporting the work that you're doing.
There are no to this probably, and a little bit of a yes. So everybody is aware that what our needs are. Let's be frank and honest. When we have a VR, it's from certain people that want to go. We have to reduce the amount of staff we have in this organisation, and there is a risk to doing that. So I could not sit here and guarantee anything to you. There is a risk in doing that, but we have no choice. So we have a couple of choices here. We don't take this and we don't wait the money that we need and we go bust and somebody else comes in and does this for us. And they'll do it anyway, and they won't care about whether I'm making savings here or not. It won't matter to them. Therefore, there is a risk and we have to do it. We will try and manage it in the best way we can. And the reason that we're managing this, flagging this risk now, is so that we can make sure we've got that corporate support in. And if you're wanting to do that in your space, that's absolutely fine. I think that's probably the best way to handle it.
Yeah, I need to come back on that. You know, this is the section adult social care, which is the lion's share of the budget. We are being looked to for the lion's share of the savings, and this is part of the transformation programme. It's part of the other work you're doing, and it links into what we've just been talking about. So I would say it is really important in this case that we are given the resources, even if it means saying to someone, sorry, we can't let you go at this point in time, to ensure that we are able to deliver this. Because if something goes wrong and we can't deliver it, you're going to the bust anyway.
Yeah. Thank you.
So, just come back on that point.
Okay, on that point, but I do need to go to Councillor Woods, who's been waiting.
Yeah, just to say, if I could just remind you, I did say at the beginning that 90% of our budget is spent on the care. It's not the staff. So we're not going to save a huge amount of money by losing staff. And you know, I think some of the positions in the council are saved from being in the VR anyway. I don't know about our team, but some of them are. But just be aware, you know, that the savings are in getting better results for people, not getting them in care homes if they can stay at home comfortably. And that is what we're trying to do.
Yeah, I think I have to say, I think we're all on the same page there, but I think there is a valid point to be made, and I think it's not going to hurt. And I'm going to go back to the committee first, but we all want that, absolutely. Councillor Woods.
Yeah, yes, I probably missed a point here, but we've been talking about preparing for adulthood in the past. And I was assuming that was starting at 18. Now I'm being told it's only just starting at 18. And that's where I've lost the track from other meetings we've had to this one.
Thank you, Councillor Woods. So as part of preparing for adulthood, we, from an adult social care point of view, we are interested in those people at the age of 14 is when, and that's when we will be actively working with individuals. So not at 18, it's far too late for somebody by the time that they're 18. So you can see in the presentation where we were last year, we weren't getting to some of our assessments until somebody was nearly 24. That is in absolutely no way where we would want to be. You can see the graph coming right down. So now we are looking at those completing assessments by the time somebody is 18. It's still not where we would want to be. So as we progress forward with the work that we're doing and the work that our Preparing for Adulthood team have completed and changes in their processes, the linking that we're doing in terms of with children's social care as well, we are continuing to see a downward trend surrounding that. We are ambitious in terms of where we would want to be, and we are continuing to see that downward trend. So yes, we know about people now from the age of 14. We are actively working with people, particularly post 16 is when we're actively working with them and linking in with our commissioners as well. So yeah, you're right. The graph would show that it's 18 that we're completing the assessment, but we know about those individuals. We know of that individual. So you will see a continued downward trend. And where we would want to get is those assessments being completed by the time somebody is 17 to 17 and a half is what we would want.
Thank you very much.
Thank you. I'm just going to go to the last speaker on this before we go to a recommendation. So can I go to Emily Kirkstone, please?
Thank you. After discussion about the risk of red and whether it's staff or time availability, obviously I wouldn't want to push the work programme too much and demand something too quickly. Would it be wise, after making recommendations to the executive to try and come up with some answers to these issues, is it possible for us to receive a report from the digital team on what is or isn't actually happening, please? Because without this in place, or without the flow of work coming from that particular area, the rest of it will fall down. And because you don't have the data to work from, and one does go hand in hand with the other. And if one hand isn't able to keep up, then the savings that you're trying to make are going to struggle dramatically. And I think that if we're scrutinising, we should scrutinise what needs to be scrutinised. That's part of it, and I would like to see that coming forward onto the work programme. Should it remain being a problem? We don't seem to scrutinise the digital structure of the council enough generally, I think. Thank you.
I'm just going to go, I mean, okay, I just want to just make a suggestion, okay? What I'm suggesting is, and you can tell me if you don't like it, all right? I'm suggesting that we take to the executive that we want to ensure there is no destabilisation to corporate support services and capability because of the VR process. What we want to do is ensure that we keep valuable staff here, valuable staff. And by not keeping people doing a job will cause this council far more money, because they'll end up having to train other people, having to bring other people in to do the job. So you're absolutely right. I mean, everybody that spoke today is absolutely right. I don't think we will hurt by actually, on this report, it actually brings it out on 4.2, exactly where there are some risks, there are some areas of concern. So I would say we won't do any harm by doing this. All we will do is rubber stamp the fact that we have raised this a concern. And I think in the long term, this will cause this council to save money, because you will have your staff in place. Now, I appreciate staff who want to go, we get that. But I think to actually recognise valuable staff doing this work, I think it has to be done. That's our responsibility on this committee. Now, I don't know if anyone's happy with that. They're not happy. Well,
can I just make sure you're fully aware? So when we talk about staff, it isn't about our adult social care staff. So our adult social care staff, when they're social workers, adult social care practitioners, occupational therapists, and our and our senior team that support those, they are not, they're not relevant to this. They're not being offered VR. They're not eligible for VR. That's not what we're after here. So, and most of this programme is delivered by them. So everything we do will be delivered by the staff that aren't affected at all by VR. What you're seeing in here is some digital support, and I absolutely agree. More than happy for you to get a digital report because I've got one. We can have that sent through to you. We can make sure that that comes, and we can ask our digital team for timescales and for that as part of that process. I think that's absolutely fair. I think what you will see, some of our workforce, our workforce shortages, and when we bring our workforce then, thank you, we will bring that to you so we can describe that to you and what we're doing. And the fragility in our workforce is the fact that we have a lot of, or a percentage of, rather than a lot of, locum or agency staff. And when you're doing a programme of change, as they change, it's how we make sure we embed this in the majority of our staff. And that's some of the risks, but we'll talk that through when we bring workforce to you. So I think that's not about VR, that's about actually an ability to recruit into social work. That's an area of concern for us all nationally. So I think that's fair.
Okay, well, it's up to you, committee. I mean, I was reading 4.2, and if you read 4.2 on page 41, it does actually make some clarity there, but I don't know. So over to you, committee. What do you want? Do you want to propose that we bring it back here and look at the digital side of things before? The peer review, it will not be till mid-April. We can either wait for that, that may bring it out then, and then we take it forward after that. I mean, it could be a lot of things come out of the peer review, to be fair. We could be jumping the gun, and that's a possibility.
Yeah, I think for me, the important thing is to make sure that executives are aware that we are highlighting this issue.
Yeah.
It's difficult to know. I think a lot of this may come under corporate rather than adult health scrutiny. So it needs to be looked at in terms of which is the correct process to go through. But the important thing is that we as a committee highlight the concern of this, because it is jeopardising the risk of us not achieving the savings that we need to achieve through this programme. So I would just like to say the committee is asking the executive to look at it, request a report from the appropriate body. I don't know who that will be. And then for us to actually get some sight of that report afterwards to make sure that it's been followed through.
Mel, do you think the report should come first, or do you think we can do the recommendation and ask for it?
I think you should don't wait for the, this is very different from what the peer review will come out with. So I would suggest you took this as one item. It's a risk, it's a red risk on here. You're concerned about that risk. You want to know, is that being dealt with? That's what you're asking.
That's fine, that's good. Keep pressing. So sorry, Councillor.
Are we having to, it sounds like we're sort of just passing our seat belts for turbulence, but I'm happy to second that recommendation if it requires a seconder.
I think we all, I think we all are in agreement about we want the same thing, really. I think this is not going to hurt at all. I think this is going to go forward, and I think at least it shows that we have got some concerns, and we want this to work. So, you know, but we are here to find efficiency savings. Of course, that's paramount in our minds. So are you happy with that? You're happy with that recommendation? Okay. Do you need to read the recommendation, or are you happy? Everybody would like the recommendation to go to executive. Can you just please show hands?
Sorry, can I have it read? So I can understand.
So I don't wrote it down.
I wrote that bit there, ensuring that there is no destabilization to corporate support services and capability by the VR process. The digital report, which includes the digital report, which includes the information that we would need for the digital report.
Is this digital from within digital, or is this digital within corporate? Because they're two different things.
They are two different things, but I think.
And I don't know, I'm assuming that digital in this instance is digital that is creating systems from within the underbelly of brilliant Somerset Council that support everything above it in each department, mind you, in one way, shape or another, or I'm completely off kilter. So I'm not certain, hearing that, which digital we're referring to. And if it's digital within, you know, that's, you know, backing up what you're doing in adults and any other department, then that's transport and digital and not corporate, is it not?
So what you're after, I think, and you know, I'll help you out with the recommendation here. I think what you're after is assurance that the digital platform that we require in adult social care to deliver this function of our data, because we've got it, but it's really clunky at the moment, and we need a proper digital system that Microsoft are working on with us, is resourced and ready at an appropriate timescale, because that's what you're after, isn't it? So what you want to know is it happening? What's the timescale, and is it on track?
Have we got,
Probably.
and have we got the available man hours?
Have we got the capability?
Because of this-
Absolutely.
Yeah, I think what I would just bring it back to the fact that the implications were put in this report as implications on 4.2, clearly stating that it could be destabilised by the current voluntary redundancy process. So I mean, that's in the report, literally highlighting, saying there is a risk, there is an issue, there is a problem. So I think we need to reflect on that. That was in this report. Had it not been in the report, we may not have actually felt that, but it actually says here, quite clear, the initial feedback also warned that the progress on adult social care change also depends on access to corporate support services and capability, which could be destabilised by the current voluntary redundancy process, ensuring the sustainability of this programme and its progress remains of key importance over the coming months. So that's what the report says. So that's where we're coming from. And I think for me, that with the risks that Emily showed, actually concern. Now the digitalisation, of course, is paramount. But what I'm saying is, it's for this committee, adults, health and adults, we are raising this as a concern from our committee. Yeah. Where the digital comes in either way, doesn't matter. We are raising it from this committee. Based on the risk, okay?
Yeah.
Right, everybody happy? Can you just show a sign of hands, please? Lovely, unanimous, thank you very much. Good. Right, we now, do you want a 5 minutes break, please? I apologise, I forget that people need breaks, I'm so sorry. So if we come back here, yeah, if we come back here at 12:10, you've got 8 minutes. Okay, thank you very much, members, thank you. We now are on item 8, Adult Social Care Performance Report, which is page 65 to 80. And I invite John Hatfield to introduce this report. But prior to that, we'll go to Councillor Wakefield, who might want to say a few words.
Well, all I wanted to say was that there are some good things to see here. And I think one of them I've noted was the hospital discharges, which have, for people going home, have gone up from 91.7% in February 23 to 94.6% over 65 in February 24. That, that's an improvement. People going straight home from hospital, which is what we'd like them to do if they possibly can. And I just wanted to say, I mean, one of the things I've learned in my inductions, which haven't finished yet, and I'm still on a huge learning curve, is that the interface, I'm sure you all know this, but the interface between the NHS and adult social care is a really difficult area, in the sense that if the NHS want to get people out of hospital, of course they do, they've got a big problem there. But what they want to do is ask to put them in a bedded situation outside. And we don't necessarily want to do that, because if the person's been at home beforehand, managing for themselves, if we can get them back to their home, if you put them into a bedded place, they're probably not going to go back home after that. But what we want to do is get people home. So that area is a really hard area to work in. There are some of our staff who are working really flat out to try and get this interface with the NHS working as well as possible. But it is a bit of a battle. And there's, I would say, somebody from the legal profession where, as I got older, risk aversion in the younger generation was a big problem in a way. I used to have to say to some people, are you actually trying to do a deal, or are you trying to do something else? Because we can never get to the end of it, because they weren't actually negotiating hard enough. But risk aversion in the NHS, you can understand, they don't want to be sued. They don't want somebody to tell them they did it wrong. But actually, we might say in adult social care, home is the best place for this person, and we can provide the care. Just wanted to make that point before we start.
Thank you very much. Over to you now, John. Thank you.
Thank you. I'm John Padfield. I'm Service Manager for Policy, Performance and Assurance within Adult Social Care. And I tend to come to Scrutiny on a quarterly basis and just provide an update on a series of the key measures within adult social care. So a number of them actually have come up in discussion this morning. So I'll talk through those. There are a couple where we've already agreed actions for future scrutiny meetings, so those have been noted. But I'll just step through them. So starting, apologies, some of the charts are slightly small on there, but starting at what we call the front door. So Somerset Direct, the main point of contact for people with queries to come into the council. And what the top chart on the right hand side is showing is month by month the number of contacts that contact centre is dealing with, which is actually decreasing over the last couple of years. So in 23-24 to the end of February, we were averaging just over 5,200 contacts per month. And that's down from over 5,800 in 21-22. And what the chart beneath that shows is what we refer to as the resolution rate. And we've got a target there that the contact centre are able to resolve 60% of those contacts without sending it on to into the service, into adult social care. So that can be people that are after some information and advice, and they're able to provide that. They're able to signpost the person to somewhere where they can access that information and advice. And so if that works, that means that only approximately 40% of that call volume is making its way into our social work and occupational therapy teams. And what the figures show is that that target is being met. So cumulatively for the 23-24 financial year, up to the end of February, that rate was 61%. So in 61% of the cases, those calls are being resolved at the front door, which is pretty much in line with what we'd expect on our target. Okay, now this is one of the ones that came up earlier. So this is both assessments, care act assessments, and reviews. Emily contributed earlier and explained the piece of work that's in chain at the moment to try and get to grips with this. We do know from some national benchmarking or some regional benchmarking that we've done that we're not alone here. But clearly what this shows is that in spite of the significant number of care act assessments, for example, that we're completing, so over 3,600 between April and February, we still have a fairly significant number of overdue assessments. And that's similar with reviews. So the bottom chart there, despite doing over 4,200 reviews in that 11-month period, over 380 a month, we've still got a fairly significant backlog there. And I think we agreed that at a future scrutiny, maybe the next one,
Yes.
we'll bring back a focus report looking at those two areas.
Thank you.
Okay, let's keep working through these. So this is what we refer to as unmet needs. So this is where a request has been received for somebody following a care act assessment to receive a package of home care, domiciliary care, and where despite going to the market to source that package of care, we've been unable to. And what you can see from August 22, we peaked at 111 people where we had that request. We'd gone to our providers in the market and we've been unable to secure a package for that person. Since then, and because of a number of improvements and not least putting some money into the system as well, increasing what we pay per hour, you can see how that figure has fairly significantly declined. But crucially, from April 23, has actually stayed low. So what that shows is that where we're being asked to source domiciliary care for people, we're able to do that in a timely way, and we're not having people waiting for that care. At the end of February, we had one person where we've been unable to source a package of care for them. So huge improvement from where we were in the summer of 2022. Okay, we're going a bit all over the place. So this is now looking at providers, and from the Care Quality Commission, where they carry out inspections of providers. What this chart shows is the proportion of registered providers in Somerset that had a CQC inspection rating of either good or outstanding. So at the end of February, 82.7% of registered care providers in Somerset were rated as good or outstanding. That's slightly down on where we have been. So if you look at February last year, we were at just over 86%, but it's still, you know, markedly better than a lot of our comparator councils, and it is a significant proportion of the care market that is either good or outstanding. Again, so apologies for the slightly small charts on the screen, but this is what these charts are showing is around handbacks of domiciliary care from providers. So for a number of reasons, providers sometimes tell us that they're unable to continue to fulfill a package of care. We had a fairly significant issue in 2021 and 2022, where in both years we had over 230 packages handed back. The implication of that, partly, I mean, it's often staffing is cited as an issue, and I think as the workforce has stabilised in dom care providers, we've seen that the number of handbacks has reduced. But it covers a variety of reasons. So sometimes it's the behaviour of the individual, sometimes it's to do with the capacity of the provider, sometimes it's that the provider ceases trading altogether. But the implication is that for each of these handbacks, we then have to go back out to the market and effectively resource this package of care. So 2023, 157 of those compared to 238 in the previous year. I know it's very early days, but in 2024, only 20 so far, so fairly low numbers. And this was the one that Councillor Wakefield discussed. So this is intermediate care. So this is looking at people aged 65 and over that have been discharged from hospital. And the key measure here is sort of bottom on the right-hand side. 94.6% of those people aged 65 and over that were discharged from hospital, either having gone through our intermediate care system or having gone directly home with no formal support, they've made it home. They've got home to, you know, to where they were probably admitted from. What this also highlights is the numbers of people that are going through our intermediate care bedded facilities, so 5% of those people. The numbers, and a bit of jargon, apologies, D2A, so discharge to assess, so our reablement pathway in an individual's home. You can see 5% of those discharges went to bedded pathways. Moving to stakeholder feedback now. So we do actively seek feedback from service users and their families, and we've received just under 300 responses in the last 12 months. Not as many as we'd like. We'd like to try and increase that. But what this chart shows, so the orange line on the chart is showing of those pieces of feedback, what proportion rated the service that they've received as either good or excellent. Now it does fluctuate. You can see in March, and it was only a partial month at the point that this report was pulled together, 100% of those responses had said that we'd been good or excellent. But equally, if you look at September 2023, only just over 50% of those responses said we're good or excellent. So this is all feedback, is positive and negative. And actually the key thing here is, I guess in both cases, but in particular where it's negative, is that we learn lessons from what led to that feedback, what went wrong. And then there are two slides covering these practice quality audits. So the earlier slide looking at assessments and reviews and the numbers overdue and the numbers that we've completed. What we're really keen to ensure as well is that, as well as looking at the numbers that we're completing, is that they are of a good quality and they're in line with what we'd expect an assessment or a review or a safeguarding referral to look like. So we encourage staff to complete audits of their own and of other people's work, assessments, reviews, etc. And since we've introduced the practice quality framework, we've completed over 780 practice quality audits. So, really significant number. And you can see from the table here how we focus on a particular theme each month. So in February, it was personalised care and support planning. So that was looking at care assessments and support plans that have been produced. The previous month in January, it was working with risk. So that was looking at risk assessments and care assessments. And then, apologies, you probably won't be able to read any of this, but you can zoom into it on your screen. But what this shows is the analysis that we produce from those audits. So of the 780 audits that we've completed, we've ranked each one in terms of, was it below our expected standards for a series of statements? Did it meet our expected standards, or did it exceed our expected standards? And you can see there is a bit of a mixed picture. In a lot of cases, we're seeing that it meets or exceeds our expected standards, but sometimes it dips below. And there's obviously constructive feedback in those cases to the worker to ensure that it's able to be brought up to the level that we'd expect to see. And I think that's it. So any questions?
Thank you very much, John. I think that was very, very important and very interesting. I'm going to ask a negative question now, but you'd expect me to. It's scrutiny. We've got 82.7% CQC were good and outstanding. What about the 18%? What's happened to them?
Well, there are a number. Obviously, the other options are that they are required improvement. And we've got a number through our quality assurance team where we're actively working with them to support them, to try and get them so that they're able to achieve a satisfactory or a good rating.
None were closed then, none were closed.
Well, some may have closed, but they won't be included in those figures. Those are active with an active registration with the CQC.
That's what I meant to say. Sorry, that's why I had the question. No, sorry.
So what we do, so we obviously have a good quality assurance. So we work with CQC really closely to help people to improve. And we do find that some people, we go in there, we put our quality and they improve, but then we come out and it drops back down and it bubbles along again. So we know the care homes where probably isn't working. We also don't place. So when people become inadequate or requires improvement, we stop placements in those homes until we're happy that the standard is of what we expect it to be. I think that's the right thing. You wouldn't want me placing in a home anybody that was either inadequate or requires improvement, and we don't do that. What we then do, however, is put an improvement plan in with them and have regular reviews of that. Sometimes what we also do is say, well, it's a tiny bit that they're not good enough on. Let's see what that improvement plan looks like. And then we place with caution, but we're clear about who we're placing and why. So we have lots of stringent processes in place to try and manage this.
Oh, that's very reassuring because it's always a bit of a worry. Councillor Bruce.
Thank you. I've got a few questions, so just run them one after the other and then you can respond all together. Okay, thank you for the report. So to start off with, I think I might have asked this before when you've been to a previous scrutiny meeting, the calls that are coming in that are being kind of diverted, so they're not going through. What happens in terms of following up with what happens to those people? So if they are referred to a voluntary service or something that's not a statutory service that we provide, how do we find out whether they've actually, that has resolved? What does resolved mean? So that's the first one. Secondly, is there any kind of correlation between the fact that we've got a lot of overdue assessments and reviews and the fact that we haven't got much unmet need now? If we then catch up with those assessments, what impact will that have on the unmet need? Is that going to make that worse, have any impact at all? And then the last one was just, I suppose, more an observation on the quality audits that have been done, the areas where they're probably where it marks below. It would be good to know what actions are being put in place to tackle those areas that have been picked up. Thank you.
A bit of a memory test, and can I remember the first question? So the first question was about the front door, wasn't it? And the where we're signposting people. Now, at the moment, the contact centre they don't follow up everybody, but they do a dip sample of people where they've signposted them to see if that actually was a genuine resolution or if it was just a sticking plaster and actually didn't really resolve the issue. We're also doing some work at the moment to look at repeat callers, because clearly if it was signposted or marked as resolved and that person rang back 2 days later, it clearly wasn't resolved, and we need to understand that work is in its early stages, but we're starting to try and understand that to see if there are any themes around the sorts of things where we're signposting people and actually it's not providing the solution that they wanted.
Can we have feedback or data on that in the next report? Thank you.
Yeah, because we're going to have our overview assessments in August. So we do really want you to come back with a really good report on that one, as much detail as possible, if that's right. Thank you, Councillor.
There's 2 more questions.
Yeah.
Oh, I beg your pardon.
So the second question was around unmet needs and overdue assessment. I think you're right. I think there probably is a correlation between the two, because we know that a number of those care assessments, when they're completed, will result in a paid service, and so that will increase demand on our sourcing figures. But we don't as yet understand quite the impact that might have, and I think we may start to see that with this work that's going through now to try and bring that overdue assessment figure down. And we will monitor the two together to make sure that as the assessments come down, it's not that the unmet needs is going up.
I'll pick up the practice quality one, and just following on from what John has said then as well, we've actually got quite a good home care market as well, so we've got quite a good supply of home care markets at the moment, but it's absolutely, the more assessments that we complete, the greater impact that potentially that's going to have on our home care market. Just picking up from the practice quality, so we've now got a practice quality board that's in place, and that meets every single month, chaired by our principal social worker and our principal occupational therapist. We now have dedicated roles, so we've got practice development advanced practitioners within social work, and we've also got some specialist OT roles as well. Now, fundamentally, their role is to pull out everything that's come from the practice quality board, the learning from the audits, to really embed all of that change and improvement into our workforce. So they're involved in our practice quality boards as well, that they meet on a monthly basis, and they then bring up the learning. So that could be learning from audits, it could be learning from SARS, so from our safeguarding adult reviews. It could be learning from LEADER, which is our learning disability mortality reviews as well. All of that learning comes through and comes in, and it's the role and responsibility of our practice development APs to really embed that into our workforce. And it's the so what question. So you've identified this, so what are you going to do about it? And that's the action plan that we're now putting into place.
We'll make sure. I do apologise, I don't mean to cut people up. It's because I've got the list coming from me, from my learned friend to my left. I tend to be thinking, oh, next one. So apologies about that. So Councillor Govia.
Yeah, thank you, Chair. Yeah, as Hilary said, a very helpful report. Quick question on the overdue assessments. I'm assuming these are done on some sort of risk assessment basis. So there is a temptation, that's why I guess we've got quite a lot that maybe are deemed as low risk that have been waiting for over a year, and that would be sort of, perhaps you're not as you're concerned about all overdue assessments, but those are perhaps ones that you're less concerned about because you think you know roughly what's going on there. So the nod suggests that is the right answer to that one. And the second one was going on to what Sarah touched on, which was the discharges from hospital, and it was around. I think the figure was 5%. We said that we actually came out of hospital into a bedded setting, and I just wondered how many of those would you deem it inappropriate? They could have gone home if the right package had been put in place, and how many of those, if you like, fell on our lack of being able to provide domiciliary care or whatever, or how much just fell on the hospital, forcing them out, for want of a better description. Thank you.
Yeah, so two really good questions there. In terms of the assessments, just to provide you with some assurance really, and I'll make sure it's included in a report back to Scrutiny. So we do risk assess every single individual, and I cannot enforce enough, behind every single number is a husband, wife, mother, father, son, daughter, and I reinforce that to our workforce all the time. We risk assess every single work list. So all those individuals that are waiting for an assessment, if we could, we would see everybody tomorrow. We can't, so we have to be able to prioritise individuals. And we've got a priority matrix that is reviewed, that we've got a whole document, which I can make sure you've got a copy of it when I come to Scrutiny next time. In terms of the individuals coming through to intermediate care, there will be some individuals that probably could have maybe gone through onto reablement. We scrutinise the decision making within our transfer of care hubs, which happen in our acute hospitals. They're multidisciplinary, so it includes people from the hospitals, social workers, community, physiotherapists, occupational therapists, to try and make sure that we get the right decision in place for individuals. Out of those individuals then that go on into intermediate care, so into a bedded provision, we have around about 40% of those individuals then that go on to home. So they don't then go in and live into an ongoing long-term placement. So we could get that better, and I think that's what we're looking at doing. So there is definitely still work to do within that system, within our intermediate care system. But we are constantly reviewing that and looking at that at the moment. We have got quite a large programme in place at the moment, which includes colleagues from Somerset Foundation Trust as well, because it's not just adult social care's responsibility, it's also linking that in through to Somerset Foundation Trust. And as well, not everybody that goes into intermediate care will come through to adult social care. Some individuals self-fund their care. Some individuals end up, they come into intermediate care within Somerset, but actually choose to move to a family relative that may be outside of Somerset as well. So various different factors.
Thank you very much. Can we now go to Councillor Oakes, please?
Thank you, Chair. I wonder whether we were seeing any difference in inspection outcomes now that the CQC have changed the inspection process.
Yeah, I think we attributed some of the decline in inspection outcomes to the risk approach that CQC were taking. So when they changed the framework, they were inspecting those that there were concerns around, which were more likely to have a less good outcome. And I think we did see, we dropped quite sharply by about 7 or 8% in terms of that good or excellent. And I think that is the case. I think now CQC are kind of, they've moved beyond those that are causing concern and sort of back into business as usual.
Thank you.
Thank you very much. Thank you. Councillor Sue Osborne, please.
Thank you. Actually, quite a chunk of my questions have been answered. I think some of my questions were very similar to Councillor Bruce's, so thank you for that. The other question I would have, though, is when you send out your feedback form, of the absolute total you send back, I know you put in the numbers you've had back, in this case 266, but what is the percentage returned? Because if, for example, you only got back a quarter, that possibly gives you less great quality data than if you got, say, 50 or 70% back. That could be quite helpful to know, especially as it does seem as though, because it's mentioned specifically in the report, there is a certain amount of weighting put on that. The other bit is relating to your audit table, which carries a lot of detail. But what could be really helpful is to have trends on there, because all we're seeing is what's now. I know I've seen previous performance reports where you've had arrows showing the direction of travel is up, it's down. So you can see, and also what's the target? Because although you're in anger for some of them, and again, it could be the previous month, there's been an improvement, but it would be helpful to see what the targets are. Is it 90%? Is it 100? Is it a different target for each of those particular measures? As that can happen sometimes as well. That would help to enhance the quality of the report. And also, is there some way of putting in there? We've talked a lot about peer review forums, peer boards in relation to reviewing packages coming forward. Are they right? Can they be changed? It would be helpful to know of the packages that are assessed, what percentage remain unchanged, what percentage are changed, perhaps downwards, that they can be done for less, and what percentage of those might need to actually have more resource put into them because the needs of the client have changed, and when they're overdue, that could be important as well. And in terms of sort of the hospital discharge, where 96% of people are coming home, what percentage, and I don't know whether it's a stat we keep or not, what percentage wind up being readmitted back to hospital, say within 28 days or 60 days, because if they're going back into hospital, has the care we've provided or not been providing been the right care to prevent that? And if so, if they've been readmitted to hospital, they're probably going to come back to us again, possibly with additional needs. So I'm not sure whether that's a stat we keep or whether it's something that the ICB keep, but I think that's something that could be quite helpful in this report, because it is a movable feast. I don't know, one of my recommendations would be that maybe we have a look at what the targets and the criteria we're actually seeing in this report. Is it the right data for now? Is it the right data going forward? Does it need modifying? And is it something that this committee may want to feed into? You want to come back, John, on that?
Yeah, I'll pick up the first question, which was around the feedback that we receive. So it's not, it is completely voluntary at the moment, and it's not a case that we send a physical form to people and ask them to fill it in, thereby being able to calculate a return rate. We actually include a link to the feedback on every document that we send out to people. So every care assessment that goes out, every support plan, every interaction with a member of the family, the email will include a link to it. But I take the point that actually we're only seeing a sample of the people that we've dealt with, and that could be people that felt very positive about their experience or very negative about it, but we're not seeing many of those in the middle. So we'll think about how we can improve that. I'm trying to remember the other questions. There was one around readmissions.
Yeah, and the discharge. I think that was a good point actually about the discharge. How many people are readmitted?
Yeah, so one of the key things that we look at where people have been discharged from an acute hospital into one of the intermediate care pathways, so either a bedded pathway or reablement pathway, we look at the outcomes at the end of that pathway, and one of those outcomes could be that the patient became unwell and was readmitted to hospital. The numbers are minimal. I think I'd need to check the exact figures, but a couple of percent are readmitted, and currently, although it's about to be discontinued, there's a statutory measure, the Adult Social Care Report, on which looks at people that were discharged to reablement and whether they were at home. The figure they use is actually 91 days after discharge, and effectively, if they were at home, then it was considered that it was a successful period of reablement. If they weren't at home, so they'd gone back into hospital or they'd gone to a care home or something, it was considered that it wasn't effective. But that measure is actually being replaced from the current financial year, so from 24-25.
So in that case, when that measure is replaced, presumably that will be another statutory thing to report. Should that also be on this performance report as well? so as the committee can have sight of it.
Yes, I mean, very briefly, all of the statutory returns at the moment for adult social care are on an annual basis. So we tend to report them to scrutiny once and then don't bring them back because they haven't changed. But there's a new method of calculating the statutory returns that starts from this financial year that means that they'll be calculated on a quarterly basis. So I think you're right that in future, these reports can include those statutory measures as well as some of our kind of internal service measures as well.
Yeah, I think that would be very helpful on a quarterly basis, I think, to come back with that report. And then it will automatically be it'll be a natural seamless report that goes in. So I think that's excellent. Thank you very much.
Yeah, I'm sorry, just one final thing. Sorry. We have 40% of people at first contact come into ASC. The other 61% are signposted back. Do we have any measure of tracking how many people may come back to us, say within 28 days or 90 days, because whatever they were signposted to wasn't the right thing for them, or they were even sent back by the person they were signposted to, which is not unknown, because that would be helpful as well in terms of fine-tuning the triaging part at the beginning.
It's not something we have currently, but it is a report that we're working on, and it's certainly something we can bring back to scrutiny in terms of, you know, the numbers that recontacted the contact centre within, say, 30 days, 60 days, 90 days. We can produce something and bring that back in.
Yeah, that would be really good, John. Thank you very much for that. Okay, I think we know, if that's okay. Oh, no, sorry, Councillor Pearlson.
Just a quick one. I'm looking at the assessments, overdue assessments, which is now over 100% increase on this time last year. What's the plan? And why is it so much higher? I'm sure that there's a pre-assessment in there of whether people really need an assessment or not. Obviously that's not within the data and it's very difficult to equate. So that's a high number now. That's getting a bit out of hand. Thanks.
It is a high number. It's a number that keeps me up. And so it's a number that I am very committed to bringing down, because like I said, behind every single number is a individual husband, wife, family member, son, daughter, mother, father, butcher, baker, candlestick maker, neighbour. We have got there's across the board, we've got various different challenges within our teams. So we've got some workforce challenges, which has not helped in terms of the productivity that we're seeing. So I've got some teams that I've got 50% staff in at this moment in time. So from a risk point of view, we're prioritising those assessments. But assessments are being done. It's not that there aren't assessments being done. There's an awful lot of work that is being completed by our teams. We are constantly looking at that demand management as well. So looking at ways in which we are trying to reduce those numbers of people coming through to the front door. So we're working very closely with Somerset Direct. We're also linking in very closely with our community agents as well. And we're sharing some of that data now with our community agents. So we're looking at actually, we know that we're not going to get to this individual. What can you go in and do so that we're not leaving individuals and people at risk? I now operate a weekly oversight meeting. We've got trajectories. Each team has got an individual trajectory in place. It wouldn't be appropriate for me to put a blanket target across each of the teams because they've got various different staffing challenges, or they've got various different demand coming through the front door as well. So across all of our community-based teams, that includes our mental health teams, learning disability teams and our neighbourhood teams, each team now has a trajectory that's in place that is monitored and tracked on a weekly basis. We've set through expectations as well, so I monitor and track in terms of productivity, and there's a lot of validations that are also being undertaken as well to make sure that we are having those strength-based conversations in the very beginning when somebody contacts either Somerset Direct or then through to the triage team. So we're making sure that we're bringing through the right people at the right time. I'm also linked into a wider piece of work, the national piece of work surrounding waiting lists and people waiting for, be that a review, be that home care, be that an assessment as well. We're not the only ones struggling. In some ways, it doesn't matter about anywhere else. We're all worried about Somerset and the individual person in Somerset. But what we can learn for other areas is invaluable, really, as well. So we're doing quite a lot regionally, and then I'm doing some national work as well to really look at those assessments. Please be assured it's not a position that I would want to be in at all. And we're doing some very regular work, and there's a robust sort of oversight, which I'll bring back to you and give you some more detail.
Thank you very much. I just want to say that even though the numbers are infuriating and keep you up, I'm sure they keep other staff members up as well.
Yeah.
And then of those staff members that are just like debating whether to stay or not due to the pressures, it's probably keeping them up a lot. And so to the ones that hang on in there, from everybody that's at council, not just in this area, but in all areas across the whole cohort, they deserve a huge amount of thanks. Thank you.
Thank you very much for that. Thank you. Councillor Woods.
Thank you. I actually want to congratulate you because from what I see from the voluntary sector, the interaction between the NHS and yourselves is very good. And I think if people are being cared for at home under the NHS and then being cared for by you, the interaction is good. I do worry a little bit about the readmissions, and before Sue's put it beautifully, but I must see more percentage of readmissions than anybody, I only see a very small portion of readmissions. Perhaps I see 10 people that have had problems and they've been out, and the next thing I know, they're back home again, and then they're back in hospital again. And that's what I see with the voluntary sector. And so I must see an awful percentage more in terms of what I do see, Sorry about that.
So I think we have to think about people and their age of the population. So when somebody goes into hospital, let's say they're 85, 90, because that's the age group that we tend to work with. So I look at that and say 60, 65, and lots of people have gone home. Well, good job, really, because actually we are tending to work nowadays with everybody that is 18 and above. And actually, if somebody's going home, it's great that they want to go home. And if they're 100 years old and they're going home, let's tick and fantastic. However, something's going to go wrong. If they're 85, they may well fall. They may be going in for something else. But what's really important for that person is the length of time that they can spend in their own home before they have to go back in, get fixed and get back home again. So readmission isn't always bad. Readmission is about how do we support somebody to stay in their own home as long as possible. And they will often go in with something different because they're an older person. And that's what happens to people. But we do monitor it, we do manage it, and we do look at it. It's something that's looked at both by our acute settings and ourselves. So it's something we look at very regularly. Thank you.
Thank you, Mel. I'm looking online, so please don't think anyone that I'm not looking at online. We are checking to make sure there's nobody online. Okay, so I just want you to know that we are still checking with you. Anyone that wants to speak, sorry. What I was going to say was that I think as counsellors, we've all become counselling, because we end up going to somebody who's got a problem, who needs help, and then we end up directing them to the right position. And I think that's fair, but I do think readmissions are not always negative. Sometimes a lot of people have come and been remitted 3 times near me, and now they're much, much better. So sometimes it happens, I get that. Okay, everybody, we are running half an hour late. I apologise if you've got another meeting, but hopefully this won't take too long, although it does need the same importance, of course. This is item 9, Adult Social Care Assurance Update, and I invite John Padfield again to you've had the short straw this time.
I'm going to bring some friends this time. There's going to be a bit of a double act with myself and Emily. So just to set some sort of context before I share the slides. So we provided an update to Scrutiny a couple of months ago that talked about the changes to the sort of assurance landscape in adult social care, and the fact that the Care Quality Commission were going to start inspecting adult social care departments, which they have. And part of our preparation for that was that we commissioned in Somerset a peer challenge, a peer review from the Local Government Association, the LGA. And we said at the time that we would come back to scrutiny and update following that. That peer review took place from the 5th to the 7th of March. And at the end of that process, we received some initial fairly high level feedback. So that's what we're talking through today. We're expecting a formal report back from the LGA at some point this month, I think later this month. And obviously we'll bring that back to scrutiny at a later date as well. But just in terms of the kind of scope of the peer review. So the peer team that came to Somerset consisted of 8 experts from other councils across England. It was sort of chaired or led by a director, so one of Mel's equivalents from council in England. We also had senior operational and commissioning staff as part of the team, and it was coordinated by an expert from the LGA. They spent 2 days on site in Somerset, and during those 2 days, they held over 30 meetings with a variety of people, so adult social care staff, service users, people with lived experience, partners, providers, members, and they met with more than, I think it was 220 people in total across 2 days. So it was a really kind of intense process. They spent about 25 hours on site at the council, which equated across the 8 of them to about 40 working days across 2 days. So it was really intensive. But they did make the point that although it was intensive, it was an indicative process, because within 2 days they couldn't possibly get into every area that they perhaps wanted to. On the 3rd day, the peer team pulled together their feedback, and they presented to a variety of staff, including Mel, including Councillor Wakefield, including the leader of the council and the chief executive of the council. And the slides that I'll put up on screen in a second are the slides that the LGA shared with us as part of that feedback process. So I'll stop talking now and I'll share the slides. Okay. So this probably says a lot of what I've just said, but basically it was we invited the LGA to come and carry out this process with us. It was intensive but not comprehensive, and the feedback was offered in good faith, designed to help us drive our own improvement. And so it wasn't a substitute for CQC, a Care Quality Commission inspection, but what we did was ask them to focus on the same areas of the Care Quality Commission that we know that they will look at. And that's these 4 areas. So these are the 4 key areas that the Care Quality Commission will look at when they carry out a formal inspection. So working with people, providing support, ensuring safety, and leadership. So the feedback from the LGA, whilst they gave us some sort of general feedback, which is in the next couple of slides that we'll run through, they also gave us some specific feedback grouped under these 4 headings as well, which are things that we need to think about in terms of our continued preparation for CQC inspection. So, some of the key messages. I won't read these out to you, but the top one there, they talked about considerable ambition. So they saw from the people that they spoke to, which actually included staff at all levels, and actually mainly we tried to keep managers out of a lot of the meetings because we wanted them to talk to social workers, to occupational therapists, to adult social care practitioners, etc. And they noted that ambition, but one of the challenges back to us was about the so what. So, you know, we've got ambition, but can we answer that so what question? What are we doing it for? And also that thing around what does good look like? Can we describe what we think good would look like? And those are probably the sorts of things that CQC will ask us. So we need to think about those. They talked about that ambition, but also the vision of the unitary council, which is obviously now a year old. And they felt that there was more that we could do to fully realise the potential of being a unitary. And Mel's talked about some of that around housing, where we hope that we'll see some improvements in the coming months. They said that the staff were passionate, experienced, and committed. That was in the senior leadership team. But they sort of tempered that with it being an asset and a risk in terms of the sort of single points of failure. So there are lots of people, well, not lots of people, there are some people that have lots of knowledge, lots of very sort of expert knowledge in particular areas, but they're one person, and if that person leaves or is not available, that's potentially a risk. So they picked up on that. They commented on our strong partnerships. So with providers, with the voluntary community sector and with the NHS, they identified some areas in relation to market shaping that we can improve on, but did understand the constraints of the financial emergency that we were still under whilst the peer challenge took place. And they also talked around that, you know, that the peer challenge and CQC inspection is a corporate thing. It's not just looking at adult social care, it's looking at the council. And so actually the interface with adult social care, and we talked about it a bit today, some of the corporate support structures within the council, how crucial they are. They talked about strong performance and commitment to support, e.g. direct payments was one of the areas they picked up. So we know that our performance in the uptake of people using direct payments is very good. But the challenge back to us was, can we replicate that performance and that ambition in some other areas as well? Probably one of the key ones, and probably one of the ones that Mel was most assured by, was that they didn't find any areas of immediate concern during the couple of days that they were on site with us. So that's reassuring. It's worth saying as well that another part of the process, as well as those 2 days on site, was case audit. So they came in separately, two members of the peer team came in separately and did an audit, a random audit of some cases that we provided. And the same applies there. There were no areas of immediate concern from those case audits. They commented on strong and innovative practice, talked about how enthusiastic the staff were, and actually some of the feedback that we had from staff was that they'd quite enjoyed it, and they enjoyed being able to talk about some of the work that they're doing and the difference that they're making and the innovative things that they're doing. Whereas I think some staff thought that that wouldn't be the experience that they'd have. And having met with our Working Together board, which includes people with lived experience, it is in its early stages, and they said that we've got a good foundation for co-production and that we can build on that board and start to use co-production a bit more. Yeah, I'll give you a break from my voice.
Okay, so I just wanted to pull out some of the sort of the strengths and areas of consideration under the 4 key key themes for the CQC assurance. So in terms of looking at how local authorities work with people, so some of our strengths is strong evidence that we're supporting people to live independent lives, well-established use of direct payments, an OT strategy that is reducing the waiting lists and supporting choice. They found that our mental capacity assessments were strong and a good assumption of capacity. And the development of our specialist teams, following on from the restructure, so things like our learning disabilities team, our preparing for adulthood teams, was developing expertise and within our staffing structures. Some of the areas for consideration that actually we picked up on today as well. So they talked about our triage process within our neighbourhood teams. There's some slight different models. Is that good? Is that not good? They talked about whilst they can see that the levels of overdue assessments and reviews are reducing, they still remain concerned in terms of the volume of the high level, as much of the discussions that we've had today. They talked about need to review the support for carers in an emergency, particularly in terms of respite. So again, we've talked about respite today. Our prevention offer is strong, but can be fragmented in terms of communication to the public. So what they were talking about is if somebody picks up the phone and speaks to Somerset Direct, they get a really good response. If they go onto our website, they may not get the same level of response. So again, it's areas that we know that we need to improve on. They looked at our Eclipse system, which is our case management system, and there's areas of where we can improve in that, particularly in terms of the linking in with finance as well. So looking at theme 2, which is about our commissioning. So we've got some of the strengths, we've got a key focus on prevention, early help and our neighbourhood working. There's lots of evidence in terms of partnership and collaboration as well. So again, pulling in from the work with the NHS, work with our voluntary sector. There are opportunities for people to feedback, and there's a sense of taking into account what people are saying and what we're going to be doing, and then how that feeds into our co-production through our Making It Real board. The teams are passionate about individuals, and they're focused on providing the right outcomes for people. I mean, that's great that you've got passionate, motivated workforce, and there's a strong approach to provider quality as well. Some of the areas for consideration was about our prevention agenda is well developed, but the financial context can potentially put this at risk as well. There are some risks in the market around the reliance on micro providers and the sustainability of more formal care packages and the dynamics between the two in terms of micro provision and commission care. Our ambitions are high, but there needs to be a clear market shaping approach and focused priorities that are achievable and realistic. There's a lot of data, but could this be better used? So again, comes back to our earlier conversation is how we're the visibility of that data. We've got all the data, but actually how we're utilising it and using it. And a clear approach to accommodation and support in terms of a wider housing strategy as well. So theme 3 was about ensuring safety. And some of the strengths there that they pulled out was, again, established and supportive relationships with our key partners. We've got a centrally coordinated safeguarding process, which absolutely maintains its focus on making safeguarding personal. We've got established training programs, which offers the support and flexibility approach to both delivery and training of our workforce. We review our risks, and we share those within our practice quality board as well. And our specialist teams have been developed within the local authorities. So that's looking at those improved processes, particularly for those individuals with complex needs. Again, areas for consideration, benefit from reviewing the risk form. So we've completed that already. Consider about how practice risk is consistently assessed and managed recorded through adult social care. Consider how workforce pressures might be affecting staff supervision, training attendance. There's something in here about also our Eclipse system needs to be the elements within the Eclipse system that were more visible to some people than they were to others, which has since been addressed. And there is a lack of lived experience of feedback gathered from safeguarding to manage the risk processes. Again, those are some of the quick wins that have been addressed as well. So in terms of leadership, so some of the positives here and our strengths, that there's a positive culture of challenge and support between executive councillors and senior officers. There's a political and officer leadership support for equality, diversity and inclusion, like they'd never seen before, to be honest. That they spoke very highly of that approach that we have here. Again, the positives, relationships that we've got with the ICB and the voluntary sector, an engaged workforce, and a transformation programme that is currently on track to deliver the savings and also identify the learnings as well. So some of the key areas for consideration was around housing and the opportunities surrounding housing, particularly as we moved into the unitary authority. It would also be beneficial for adult social care to set out the next phase of the transformation and improvement, focusing on the small number of priority big ticket items. Opportunity to deepen the work of the EDI, using the voice of people with lived experience. And progress on adult social care change activity also depends on access to the corporate services as well. And all councillors need to understand the pressures, drivers and change priorities for adult social care using a range of formal and informal engagement mechanisms. That's a really whistle-stop tour through those high level. As we said, we will receive a more detailed in-depth report in the coming weeks, which we will absolutely be able to share with you.
Well, thank you very, very much for that. I was very small part, I played, but very small part, but I'd say it was very, very interesting. And I thank you so much for that, because I think you've given us a good précis. Just a couple of things I'd like to say before I put it out. I would like to just make a comment. I don't think we should improve necessarily the website. I think what we should always try as hard as we can to keep somebody on the end of the phone. I think it's so vitally important that somebody in an elderly age gets to speak to somebody on the end of a phone. But many of them I speak to haven't got any access to online, don't want to know, no matter how many times I try to show them. But speaking to somebody, and I know we're in an age where we've got to be going forward, but I still think we need that contact, absolutely keep that contact. And the other thing I would do is definitely abolish acronyms. I say it every time, and I would have a law against them, and I would abolish every one of them, because I think it makes the times I spend going backwards and thinking, what is that again? What is that? You know, but thank you so much, because that's really very good. Members, is there anything you wish to? Councillor Bruce.
Sorry, I'm talking a lot today. Yeah, there's a couple of things really. I think sometimes we're accused of being a bit slow moving as a council. We're going through a transformation programme and everything. We've got this report coming through in April. I would say possibly as a committee, we could actually now, there are areas that have been picked up in here that are probably not within the service, like the website or the integration with the transformation service and things. I would say that I would be happy for the committee to say, please move those forward to executive. If there are things that you can't deal with as a service, that obviously there are things you'll be working on, you're already working on, but anything that's outside of your remit, please take it up to executive so that helps you along. Don't, wait for the report to come out and then we see it at another meeting like 6 months down the line and then it's moved up. Do it straight away. And then the other thing I would say is probably a full member briefing on this once we get the report would be very good, because it did highlight the importance of all councillors being aware of the pressures and the drivers. So please put this out to all members. Thank you.
Yes, there's nothing worse if we get things at retrospective. Yeah, I think it makes us feel inefficient and we don't exist. So I think that's a good measure there. Anyone else, please, would like to say anything? Councillor.
Yes, I think I look forward to seeing the full report. There's plenty of food for thought in there. There's plenty of positives to take away from there. And I think we did deal with the issues Hilary just mentioned. We dealt with that in an earlier item because there was that crossover. And I think she's absolutely right. We move on the stuff we can. And the other thing of things coming back retrospectively is you always tend to feel it's sort of like a done deal and that's it. And that members haven't had the importance and we don't want to be leaving members behind. Yes, to a full member briefing, once you've had the report and you've had a chance to crunch through it. But I would suggest it comes to this committee first, so we can have a crunch and decide maybe what perhaps needs to be focused on and what would be of most interest probably to members. Is it worth it, Madam Chairman, that this is going to be quite a meaty report? I know we're having this before the CQC inspection. Whether we actually maybe have a separate workshop in this particular report, rather than try and have this report plus half a dozen other agenda items. It's almost it is actually an agenda item in its own right.
Councillor Osborne, I hate to mention that you were late. This was mentioned, I'm just going to mention it.
Half an hour to find parking in Bridgewater.
Right, it's a wonderful place to be, that's why. Everyone's here. What it is we're going to have a focus group. We're going to call ourselves a focus group and we're going to meet in May. Now, what we can do is if the report's back by May, what we can do then is have these things, anything that comes to that focus group, that what we'll do is, now what I wanted to ask the members, Councillor Bruce has suggested we have it online. I don't know whether you prefer to have it in face-to-face and then have it hybrid, whichever you decide. But I do respect the fact that working councillors, it's tough and I do get that. I was one myself for years, so I do get it. But perhaps you can, in a minute, indicate to us what you would like. But I think we're going to meet in May. We're just working out the date. And if we can have any reports, that would be absolutely fabulous, if that's okay. But we're not going to call ourselves a working group. We're not going to call us anything else. We're going to call ourselves a focus group because we are focused. Everybody happy with that?
Yeah.
Good. Well, I wasn't going to take any notice if you weren't, but anyway. Sorry. Councillor Wakefield.
Yeah, I don't know if you've got other questions or comments. I just wanted to mention that one of the things they did say, and this peer group who came to see us were, as we've said, councillors and not councillors. There were some councillors and there were a lot of staff members as well, senior staff members. But what they did say, and I think you should take this away, was that they had to get their pads out and scribble down things they were learning from us. They liked some of the things we were doing. I was incredibly proud of the team, which I'd only just joined at the time, to hear them say that. And they said, we have seen things here which we're not doing in our areas we haven't seen before, and we've been writing them down. Thank you very much. Now, we obviously learned things from them, but I think that's something to take away and to thank our staff and team for what they are doing, because they're doing innovating things and they're doing things which other people think are worth commenting on. Thank you.
I must say, I've never been to one where they haven't been writing stuff down. I've got to be honest. They've always got a pad and they're always non-stop writing. And I always worry that what are they writing about me? You know, or things like that. So I always worry, don't need to say anything. Okay, all right. And with that, I think we can organise, if the members just want to stay for 5 minutes, so we can sort out the date and what you want to do. But I think, thank you all to the officers today. You've been grilled really well and you've answered the questions, and we absolutely appreciate it. But all I can say is things are going to get worse. No, I mean, things are going to get better. Thank you very much for your attendance today. I close the meeting. Thank you.
Thank you.